Okay, good
Okay.
morning. Good morning, everybody. We are now recording this meeting for a onward public transmission. Just want to welcome everyone to our public meeting in March for Northamptonshire Healthcare. It is just for technical reasons that we're not transmitting live today, so members of the public aren't watching us live, or indeed our governors, but we do intend to make sure it's available for viewing as soon as possible after the meeting. So just for you all to be aware. Warm welcome to everyone, and particularly to colleagues who'll be presenting our patient and service story later. I'll let Anne introduce them in due course, but just got a few items of business to cover first. Um, so firstly, just want to also mention that we've received a couple of questions from members of the public, some concerns about services. We did only receive those yesterday, and unfortunately, we're just not in a position to respond in the public meeting today. But we will do so as soon as we can, and make sure we've responded appropriately to the individuals as soon as we can, and of course address the matter in public at the next meeting as well. So I just wanted to mention that. Also want to mention, I think this is Chris Oakes's last meeting. I'm sure Angela will want to say some things about that later in the meeting, but I just wanted to mention that because Chris, as everyone knows, has been, I think I can describe him as a stalwart of the board for a very long time. He's certainly been here since I've been chair. So I just wanted to recognise that this is Chris's last meeting, and we expect him to go out with a bang. So plenty of contribution, Chris. So thank you. Apologies for absence. I think we've received from Itai, Itai Martin BK, our medical director. Melanie, I know, is intending to join us, but she's been detained, so she will be with us shortly. Otherwise, I think we've got everybody present today.
Just Joe. Joe's joining us a bit later, I believe.
Yes, so Joanne Lancaster will also be with us very shortly. Thank you, Jane. So that's all our apologies for absence. So declarations of interest. Have we got anything that people want to declare in relation to items on our agenda today? Notwithstanding that these things may already be recorded on our register of interest. Okay, I take that as none. Minutes of the previous meeting held on the 30th of January. Are colleagues content to approve those minutes as presented, or are there points of accuracy? I think everyone's content to approve those. Any matters arising not covered in the action sheet? No. Okay, so action sheet B, paper B, there is just the one item that I think is listed there. And that was relating to just reviewing the Marine Award, the implications, I think, around the sort of costs and lessons learned, and a review of business cases, which came up at the last meeting. Is that now scheduled, Duncan, on your audit plan or on the audit committee's agenda?
It's on our schedule. It's yet to make its way onto the formal agendas, but that's not yet in place. So yes, we've got hold of that one and we're following it up.
Great. Are you content? Is the board content for me to close that if that's sort of very clearly on the plan for the audit committee? Great. So we'll leave that with you, Duncan, and if you could report that back through a future assurance report, that would be helpful. So that's paper B. Paper C is our usual annual forward plan up until the end of this financial year. I think everything that we were due to cover is on the agenda, or indicated where we're handling it slightly differently. For example, the estates annual plan. But has anyone got any comments on the forward plan as it is at the moment? No? Okay, so we'll just note that. So on that note, then delighted to invite Anne to introduce our patient and service story, and indeed welcome Loveness and Joe, who I think are part of the team who are presenting it. I'm sure there are other colleagues as well, but I'll let Anne introduce everybody. Thank you.
Thank you, Krishni. And yes, I'm really pleased to welcome Loveness and Joe and Madalena from the CAM service. As we know, there has been, particularly since COVID, so much higher demand for mental health services for young people. And what's been really amazing is to watch how this team have worked really tirelessly to think about how we respond to that and how we work on supporting people through what has historically been quite a long wait but has improved, and I think that's been quite a fantastic transformation journey of thinking about how we respond to so much more need in our community. So they've come today to bring some information on the service and a little bit of how that impacts a patient, and so I'm really pleased to hand over. So I'll hand over to yourself, Loveness.
Thank you very much, Anne, and thank you very much, everyone, for extending this wonderful invite to us. I'll just talk a little bit, very briefly, about our mental health services that we offer within NHFT. So our core CAMs are our moderate to severe stage, where we offer therapy to children and young people, as well as medication intervention. I'm going to leave that to Joe and Maddie. Maddie will give us the patient story in the patient's own words, so she hasn't changed anything. And Joe will just talk us through the journey that a young person goes through from the point of referral right up until the point of them being discharged from CAMS. I'll hand over to you, Joe.
Joe, unfortunately, we can't hear you.
Oh dear. Her laptop.
Yes, we can hear you now.
Apologies, I have a laptop that likes to take out my sound. Okay, so initially when they are first referred in, they can be referred in from professionals from anywhere. And just to give you a number, we get on average 100 to 120 referrals a week that are screened by our CAMS Connect team, so our front door team. This has increased dramatically since our COVID days as well, we've noticed. We have looked at how we can kind of meet that demand. So we looked at increasing our initial assessment, so the first assessment they will have when they meet someone, but we've also got lots of other lower level support that we've been managed to kind of screen them out to. That supports, we have our mental health in schools teams, we have our Reach Collaborative, we have our school nurses, and lots of others that we could mention. So we've looked at all of those, and we are able to refer out to them as well, depending on the presentation of the young person. We are roughly offering kind of initial assessments at the moment between 30 and 40 a week to meet that demand, and we've managed to do that within the team. To meet kind of initial assessments, we have our non-medical prescribers, we have our advanced clinical practitioners, and we also have our international medical graduates that we have brought on board to be able to meet the demand and the need of that. We have also introduced, and you'll notice there's a bit of a time gap on the patient's journey from their referral to their support, but since then we have also offered clinical reviews. So that's a 12-weekly review that is carried out with the young person and the family to see if there's been any change in presentations. We have increased our what we call our huddle discussions, so our MDT, multidisciplinary team discussions. We have added 2 of those in a extra in a week to be able to meet the demands of the initial assessments that we're having to carry out. Back in August last year, we had a big look at all of our allocations and how many young people were sitting on that allocations waiting list. And we were sitting around a 2 to 3 year wait. We had over 600 young people. We have managed to bring that down to a currently 48, 49 week wait, and just averaging just over 300 young people. So we are continuing to look into that. We're continuing to see what we can do to obviously improve that wait list for the young person. We have increased our group offers, our therapy offers, and we also now have the iDiscover, which is a lower level where young people can come, they can attend those sessions and look at how they can be supported. So that's one of the big offers that we're doing now. And our front door team are the people who are now taken over that, and they are delivering those sessions. So that's a very brief on some of the things that we've put in place with the teams to be able to kind of reduce our wait lists and to be able to have a less of a wait for our young people waiting for our services. But as I said, there was an increase after the COVID period, which is, I think, the demands currently that we're meeting with the young people that need the services. So I'm now going to stop. And Maddie does have a presentation, if that's okay to share with you, on the patient journey. So I'll now hand over to Maddie.
Thank you very much for being part of this. I really do appreciate it. So I do have a patient journey to share with you. I've put in place a little presentation, but I've also, the young person, this presentation was done with the young person. So the young person has written her own story in her own words, and I haven't made any changes to it. So I will just read it out for you. The young person is called Chloe. She's 16 years old, and she lives across Northamptonshire. And here is her story. My time at CAMS has been very helpful. I went from attempting to kill myself, self-harming often, thinking of suicide almost daily, and planning to hurt myself almost all the time, but not being able to follow it through. After almost 2 years of waiting, I've received my intervention session, which has helped me learn how to help to cope with panic attack, times where low mood takes over, and keeping myself safe. During my waiting time, I have seen the medic to get some medication to help me cope with the feelings and thoughts while waiting for more help. I believe the medication along with the intervention sessions have saved my life. I said, when I was told the waiting list could go up to 2 years, that I wouldn't be here in 2 years. And if it wasn't for the medication and the help I got with the medication and the help that I got, I wouldn't be here today. Now I am receiving the intervention. I am a lot more confident in myself, and I have a lot less thoughts of self-harm and suicide. Over the time I have been receiving the help, I have become better. There is still work to be done, but I am better than I was. By Chloe. And just to share what happened in the background with this young person, she was referred into CAMS on the 7th of September 2022 by her GP. The referral was then screened by a CAMS Connect clinician on the 8th of September 2022, and it was accepted for an initial assessment. She had the initial assessment on the 3rd of October of 2022. Following the initial assessment, the case was discussed in the MDT huddle on the 4th of October 2022. And as part of the outcome of this discussion, she was accepted into CAMS, and also a referral was made to the medic, which was completed on the 5th of October 2022. This referral was then accepted by the medic team. She then had a medic IA, a medic initial assessment on the 13th of March 2023, to where she was prescribed medication. Following this IA, she was being seen by the medic every 3 months. And then, as Joe said, there was a review of our waiting people that's been on our waiting list in August 2024, last year. And following that, she was then allocated to a care coordinator. a care plan was made between the care coordinator, Chloe, and her family in place, which then required for Chloe to start with the My Emotion Matter group and also do some work around her confidence. She started the My Emotion Matter group on the 5th of February this year and is still currently ongoing. She sees her care coordinator twice a month, as well as the group is weekly basis. The group is about to come to an end, and since then, there've been discussion with Chloe and her family about potential discharge for April 2025. This is the journey for Chloe. Thank you very much. Any question? Yes, Anne.
Is it okay for me to come in, Krishni?
Yes, please do.
I just wanted to come in and say thank you so much for sharing this story. And I just wanted to give a sense for the public that how much support can help you in periods of difficulty. But if there is anybody who is watching who'd like to receive some help, that we have services out there for children and also for adults through our mental health number, and that we're keen. And this is just a really great example of how people have received help and has made a real difference for them.
Thank you very much, Anne. So yes, obviously quite a lot of comments and questions coming in. So I assume you're happy. Loveness, was there anything else you wanted to say before we just invite all the questions, or are you content we just go straight to that?
I'm happy for us to go straight to the questions.
Lovely. Thank you. So Angela next then, please.
Thank you. And as Anne said, thank you very much for sharing the story and the journey. It's really valuable for the board to hear more about the services, but also understand the individual's journey and her own words, which is also fantastic to have at the board. So thank you for that. Just a couple of comments and queries. Clearly, demand since COVID has increased, and that is evident. And I think everybody's referenced it. Just be interested in any reflections in terms of what you think has affected that, or how, if any way, that is reducing now or not. That would be really useful just to reflect that, please. And then also really struck by the continuous improvement approach that you've displayed. And I say continuous improvement rather than quality improvement, because I felt it was very continuous and ever present. So again, how you as a team come together to keep that live and purposeful would be great. Thank you.
So I suppose I've been here since COVID. I started in COVID, so I've seen that journey of the increase, and I think we can kind of say that the increase has been because young people didn't have their normal routines. They weren't able to mask what was going on for them. It became more evident, and this has come out a lot since they've gone back to schools, or they've gone back to education or nurseries, etc. So there's lots of things that they had wrapped around them before to contain it, and in that time, as we all know, things changed dramatically and we weren't allowed to do things. So that's where we believe some of that increase has come from. And we are continually weekly meeting to make sure that we can look at our wait list and look at what we offer the young people, because at the end of the day, they're the most important person in this. And that's where our focus is how we can make their journey within CAMHS quicker and smoother, but also that they get what they need.
Thank you, Jo. Linda, please.
Thank you, Krishni. Thank you, Loveness, Jo and Maddie, for the presentation. Really impactful. I think what struck me the most is the collaborative approach with Chloe and her family. That is really impactful, because when young people go through these difficulties, their families are also impacted. So that support of keeping it with the family, receiving the support closer to home. I think what wasn't mentioned in the presentation, which I'm aware of, is the work that you've done so much on with regards to young people waiting well. So clearly that was not someone just waiting for a service, which was her worry about the 2 years wait, but actually she's been supported to wait well. The whole family has been supported. So that gives that sense of hope. And actually, it is a journey. So really good to see that shared and has such an impact on a lot more patients who are waiting, who might otherwise think I'll just be forgotten about, but actually there is support that is available. So thank you for bringing this and sharing it with us this morning.
Thank you very much, Linda. Julia, please.
Thanks, Krishni. Hi, everybody. Thank you. I'm Julia Curtis, one of the non-exec directors, and I chair the Quality and Safety Committee. I think we've followed the journey of some of the challenges and difficulties for your service for quite some time now. So 2 comments from me. One is a huge thank you to your entire team for their resilience, their passion, their enthusiasm, those that we've met through the last few years. You know, it takes a very huge amount of determination to keep going, to hold children and families at the heart of everything you do when you are facing such huge numbers of referrals, and behind every one of those is a child or a family. So we absolutely recognise and thank every single one of you in your teams for that. And the second point was, Linda just covered it actually, was around your initiatives while people are waiting. And again, we've received quite detailed reports of those over the years, the last few years through our committee, because that for us is really, really important. You can't magic staff and magic suddenly a huge amount of capacity to see people, but keeping in touch and offering them appropriate interventions while they're waiting is absolutely vital, and has a huge positive impact for those children and young people. So just a huge thank you from me for everything that you've done. Thank you.
Thank you, Julia. David, please.
Thank you, Krishni. Thanks, Loveness, Joe, Maddie. I just wanted to say I think the story of Chloe was really quite powerful, and equally at the same time I felt a little uncomfortable because actually getting Maddie the support when she needed it was a challenge and a way of going through. And I just wanted to say what you've reminded me, and I wanted to draw out from the board, is there's a lot of continuous improvement that we're doing in the CAM services, but we're also looking at the continuous improvement that wraps around the rest of Northamptonshire. And so the importance of championing how do we find system solutions to supporting children and young people, I think, is borne out by Chloe's story. Things like mental health support teams in schools would be able to, the more we got them working there, the more they would be able to provide early intervention to people like Chloe. The new work we're doing around our 0 to 19 services in both North Northamptonshire and West Northamptonshire is about bringing voluntary and community organisations on board so that they can provide counselling advice, purposeful activity, other services. And all of those things over time could help people like Chloe get services earlier and get that support. And I just wanted to kind of bring that out today, that there's an awful lot of work we're doing in NHFT, but also as a board, that's why we're championing the needs of children and young people across the system, and making sure in a time when life can be focused in the NHS on urgent and emergency care, we want to make sure we don't lose sight of the needs for children and young people, and Chloe's sort of timeline was a really good example of that. So thank you very much for bringing that through.
Thank you, David. And finally, Robin.
Yeah, hi, I'm another non-exec director and I'm the Deputy Chair of Quality and Safety. Again, to thank you very much for your presentation today and the real recognition of the high quality of thinking and exploring new ways of managing a waiting list that is exceptional, because you probably face the single biggest area of waiting that we see as a trust. And I think we need to reflect that and accept the pressure that's on you and really thank you for your work. And I was just going to make the point which David has sort of made already, which is the need to do work below the level of presentation to us to prevent such harm for young people, and how much we need to see as a board the contribution of partners in local authorities, in public health and so on, to do the kind of work that perhaps will reduce the number of young people presenting to services like our own. We can't do this in a vacuum. We are only part of a bigger system, and we recognise that. But that is what causes your waiting list, the need to do so much more work with young people to prevent them reaching this point. But thank you for your presentation and your work.
Thank you, Robin. Joe, do you want to come back in? Oh, we can't hear you, Joe. If you turn it on and off, it worked last time.
Am I back?
Yes, you're back.
Yes, apologies. I just wanted to say that within our Connect front door team, we have very close contacts with our lower level intervention teams as well. And we have our consultation line who are very knowledgeable about the services available to young people at the lower level when they call in and they have questions. So we have built a really tight working relationship with the lower level intervention as well. So just to say that, you know, the consultation line has that information if young families or professionals need it.
Thanks, Joe. And I guess that's where voluntary organisations like the REACH Collaborative come in. And I can see sort of Loveness and Joe and David nodding there, because if you recall, the colleagues will recall, we have one of our partner governors is from the REACH Collaborative, and they described as part of their work sort of the support they provide at that a different level of need before presentation to our services. So yeah, some really important points have come out. I mean, I think most importantly, everybody's keen to reinforce to the three of you, Maddie, Loveness and Joe, the importance of the role that your service is playing, and thank you for all the efforts to improve the waiting times, because we all know that's not something we would want to you know, continue. And so to have made such a difference to your wait times since in the last few years, it does seem a huge amount of effort and work to do that, and your commitment to keep that going and keep people waiting well and use all the different skills, because that's the other bit I heard in your presentation, lots of different skills being used to complement what you do. And a sort of multidisciplinary approach, which is, we know, incredibly important. So really just want to thank you for bringing that to life and sharing Chloe's story. And thank Chloe as well, please, for sharing that with us. And thank you. It's, I think, set an important tone for the rest of our meeting. So lovely to meet all three of you, and thank you for joining us.
Thank you very much.
Thank you.
Bye-bye.
Bye-bye.
Bye. Great. Thank you, everybody, for contributions. Just to say that we are, I think, as we've touched on, we are planning a sort of slightly, I wouldn't say massively different, but just a slightly more thematic approach to our service and patient story presentations going forward. So we thought we'd start that from May onwards, and we'll say more about that then, but just wanted to highlight that that's something we're planning to do to make sure we're covering the range of services we offer, and indeed potentially yeah, just making sure we cover all bases really. So wanted to take the opportunity to highlight that. So we move on then to the risk section of our agenda today, and we have paper D, which is our risk report. So over to you, Richard.
Thanks very much, Christy. Good morning, everybody. So regarding paper D, board members will note that this month's report is somewhat longer than our usual reports, and that's on account of it including both our new risk management strategy and a refreshed risk management framework. So I suggest we deal with the regular content, so our board assurance framework content first, and then come on to consider the strategy and the framework. So there's some detail contained within the report that speaks to some changes we've made to the scores of our two workforce risks since the last report, and the supporting rationale for that. as board members will be well aware, we are anticipating a new strategy for the Trust and our group, which indeed is on the agenda for discussion later on today. As you'll see from the comment in the report on BAF 6, the exec team has already begun the work to review and refresh the strategic risks on our board assurance framework in the context of the new strategy, which will be hopefully coming in subject to the board's approval from April. So what we will do is make sure that we manage the transition from our current BAF to a new BAF that will be presented to the boards in May, engaging in the meantime with the board's committees on the individual risk register entries. So in short, the board can expect to receive a refreshed BAF in May at our next meeting. So just to finish off then on the regular content on the report before we come to the other two elements, just really to note, we're really pleased to receive the outcome from the internal auditors annual report into our risk management arrangements. We received that reasonable assurance rating, and indeed had the opportunity to have a discussion about that at the most recent meeting of the audit committee. I don't know, Christy, whether we want to pause there and take any questions on that aspect of the report, and then perhaps come on to the other two elements.
So any comments on the board assurance framework before we get on to the risk management strategy? Joe, please.
Thank you, Richard. Just a point of clarification, really, with regards to the internal audit recommendations, reasonable assurance rating. What's the, and I realise audit committee have got a grip on this, are the two directed activities for immediate effect, i.e. are they being addressed as a priority, or is it just something that's going to be programmed into next year's work programme? The first question. And secondly, given that we're at that end point of the current strategy, is there a route by which we reflect on the overall value that the BAF has brought to the delivery of this strategy before we get into the detail?
Richard, do you want to come in on either of those? I can see Duncan also wanted to comment.
Happy to. So the actions that the auditors had has prescribed, I can't remember the precise terminology, forgive me, but they weren't sort of major issues. They weren't major problems that needed immediately to be addressed. They were more routine actions, and indeed, yes, we are, as you've described, Joe, programming those in. They're very much in hand, and indeed will then provide assurance on the completion of those actions back to the audit committee at the next meeting. They are things that will be done rapidly, so we do anticipate those being closed very, very soon. As far as the opportunity to just reflect on the BAF and its role in the delivery of our strategy, I suggest probably the best mechanism for us to do that would be part of our board effectiveness review, which will be coming up over the next couple of months. And we can look at that both at board level and also then at committee level. So that's how I propose to take that one forward.
Okay, that's helpful. Thanks, Richard.
Thanks, Joe. Duncan?
Yeah, first of all, just to support everything Richard was saying, I think the Audit and Risk Committee had a good discussion about this, and has also been given some consideration as to our role in this going forward, which, as members of the public may not be aware, is a new addition to the responsibilities that we're taking on within Audit and Risk Committee. I'm also minded just to highlight and welcome the work that Paul is doing as our CFO in taking a look at splitting that BAF Risk 6. I think that's a very sensible way forward, and we briefly touched on that also at Audit and Risk Committee. That split will allow us to take a look at the short-term and the more longer-term risks that the Trust is facing in terms of financial sustainability.
Thank you, Duncan. So if there are no further questions, I think in relation to the BAF, we would just really ask to consider the changes and the level of assurance detailed in there, and request any further information, which we've done. So do we want to move on to the risk management strategy then, Richard?
Thanks, Krishna. Yes, so Appendix 2 within the report is the draft risk management strategy, and just to remind board members, this was a point of learning really that came out of our external well-led review, that we should consider articulating a separate risk management strategy to the risk management framework. We've had some conversations, as you'll be aware, through our board's development programme on what the strategy should contain. So hopefully what you'll see encapsulated here in Appendix 2 is that work that we've done together. So you'll see here that we've largely set the vision for risk management over the strategic horizon. So that will harmonise with the time horizon for our group strategy, which we'll be discussing obviously later on. Underpinning the strategy will then be a capability maturity model. We adopted a similar approach to our system partners, which enables us both to compare and contrast across the local system, but also to do some shared work on system risk management, which clearly is one of our priorities going forward as a system. So you'll see within the latter pages of the strategy that we've set ourselves essentially 3 areas of work which stemmed from those board conversations. So building the capability of our leaders in best practice risk management, making sure that we're able not just to manage harm or adverse impact, but enabled to embrace opportunities that come out of risk management together, which is the second area. And the third area then is about how we're working in partnership, and this is the multifaceted aspect. So that'll be partnership between ourselves and our group model partners at LPT, partners in terms of local collaborations, but also some of our work across the East Midlands as part of the Alliance. And you'll see there in summary, there's clearly a more detailed plan underpinning this, an outline plan as to when each of those aspects of the strategy will start. And you'll note that it's quite a front-loaded plan, which reflects some of the actions that we've already got in train. So hopefully that reflects the conversations that we've had at board workshops, and really seeking the board's endorsement of the strategy, which will then obviously be reporting progress against through future risk reports. And it might be worth, Christy, just dealing with the risk management framework, as this is not an entirely new product. Again, this was originally scheduled to come to the board back in January as part of our routine review cycle. We agreed at that stage to review the framework at the same point as reviewing the strategy, to make sure, therefore, that the framework was supporting implementation of the strategy. So it's appended to the report for your consideration. There were not material changes to the report. They were largely presentational and to bring terminology up to date, but we are also seeking the board's approval for the revisions to the framework, which will then form part of our policy framework going forward. So happy to take any comments or questions on either the strategy or the framework, and indeed would seek the board's approval for both. Thank you.
Thank you, Richard. Judith?
Thank you. Thanks for both all the papers, Richard, but specifically the strategy. I thought it was a very clear presentation, and I did also like your the photos that you have chosen. Now the question I've got is very much related to the foreseeable move that we're going to have to undergo with the BAF from our DIGBQ strategy to our Thrive strategy. DIGBQ is very clear from a risk point of view as to which, if you like, subcommittees owned which risk, whereas Thrive is more of an enmeshed approach from a risk point of view. So I was just wondering how, if you like, the non-execs can have an input into that. Will there be a boardship on that, or how are we going to sort of make that process happen?
Richard, do you want to come in on that?
Thanks, Christine. Yes, a really good point, Judith. And again, later on in the meeting, we'll be talking about the move towards some group meetings in public. So you're quite right. We need to think through quite carefully what what we're doing at group level and what we're doing at trust level, and how then we avoid that duplication. But yes, in short, we will be in dialogue with committees and committee chairs in both trusts between now and the May meeting to really configure how we take that forward. We've got a board workshop. Well, we've in fact got 2 board workshops, one in April and one in May. We'll be spending some time certainly at the NHFT workshop to consider the NHFT perspective in particular. So in short, yes, we'll be doing some of that work with you over the next couple of months. Thank you.
Oh, that's excellent, Richard. Thank you. Because just going through the Thrive, I've already sort of bagsied 4 of the Thrive elements for Performance Committee, and I thought I was being too greedy. I need to share them out. So thanks for that.
Thanks, Judith. Yeah, so yeah, we can have the that discussion. We certainly need to. I think it's important, isn't it, that we recognise where they are best managed, if you like, or overseen in terms of the feedback to the board. And so I think it is important that we follow that up. So that is an area that we'll need to build into a future discussion at the board development workshop. Joe, please.
Yes, thank you very much, Richard. Just in terms of the strategy, and I realise that it is very heavily front-loaded. The one that jumped out at me as something that I think is going to need effort and creativity, which is down for us a Q2 element, is the strengthening mechanisms for managing system risk with partners. And given what we know is happening through the changes at national level, I would just question whether we have time to leave it to Q2. So I'm not expecting an answer, but just a point of reflection from me. And then just also on the framework on page 54, the purpose behind the framework and why do we need one? The bullet points, the one thing that's missing for me, threading throughout this document, is that balance between innovation and risk. And it's mentioned in the strategy, but I think that if we can try and find some way of reflecting that in the framework, I think it's important that we try and enmesh that in helping people understand the culture of managing risk and balancing innovation opportunity.
Richard, do you want to comment? I mean, the only, I suppose, the only thing I was going to just say on the national setting is that in some ways, I wonder whether the level of uncertainty around sort of national direction of travel, not in terms of the actual, the 3 shifts and all of the longer term plan, but the model of working between in system and the changes to that, whether they're going to be clear enough for us to really understand, certainly by Q2, what exactly how the role that each partner plays, because I think, my sense is that that is going to change. The role of ICBs is being redefined potentially to be more strategic commissioners, and that may change the way in which we work within the system. So I feel less certain about that now than perhaps I did a few months ago. But I don't know if others share that. So it's probably something we're going to have to watch very carefully, because we're still awaiting things like the segmentation, the NOF, the National Oversight Framework, and all those other things, and guidance around the different roles, because the intention nationally was to try and make sure that there was a really clear or reducing duplication, I think, was the sort of key element. So just an observation there. But Richard, do you want to comment on
just briefly, if I can, then, Krishni. So yes, to your point there about system risk management, I suppose the important point is to note that we, of course, are managing risk as a system at the moment. So this is about how we further strengthen rather than how we start managing risk. And I think you're right. I think David's put a point in the chat that we were sort of anticipating the publication of the plan, and thought actually that probably made a good point in time really to then really reflect on where we want to go next in light of, as you say, some strategic changes to the overall management of the NHS nationally. So yes, to the point about innovation, we're certainly happy to add a bullet point in there just to clarify to your point, Jay, the intention of risk management to help support innovation. So with the board members' agreement, we can add a line in to that passage on page 3 there of the framework to speak to the point about risk management needing to support us to embrace opportunity. That we're happy to do that.
Thank you, Richard. And finally, Tim, please.
Yeah, thank you, Richard. A really good pack and really sets it out well. Wearing my people hat, I was immediately drawn to the fact that in the programme, 1A appears after 1B and 1C. So when I went back and looked at 1A, it's quite a broad church in terms of what the plan is. It says develop, and then does that mean develop and deliver, or is that just develop? And then you've got 4 leaders, whereas some of the executive will probably need to be aware way before, because then further down the train, you've got introducing the platform and other bits and pieces. So it was just that seemed a very broad church for actually something that probably needs a little bit better defining because of the way it sits in the programme.
Thank you,
Thanks.
Tim. Richard?
Thanks, Tim. Yes, indeed, as you allude to, it is develop and deliver. So start the delivery of and the positioning in Q2 was to reflect the fact that we needed a little bit of time just to work through what specifically we wanted to do in response to the new strategy, so that could then have a bearing on the risk management training that we put in place. And you're quite right, that will be a sort of segmented training program, so a core content running throughout, but then differentiated according to role. So yes, both board members and execs in particular will be at the head of the queue in terms of that first part of the training program. Yeah.
Thank you, Tim. Does that give you sufficient clarity? Great. So I think just reflecting on the sort of range of comments, I think we've said across all of the piece on risk that we'll be picking up the sort of further review of the value of the BAF, if you like, through the board effectiveness review, Richard, which was, I think, Joe's first point. Edith also commented on the making sure that we understand the sort of allocation of risk oversight for committees and how we do that in a way that sort of each committee can add value to. We touched on the innovation element being included within the document, which I think you said you were happy to include. And other than that, I think broadly it provided some clarity, obviously, around the training, the learning element. But our colleagues are supportive of endorsing the strategy, notwithstanding those comments that were made. And indeed, just obviously noting the board assurance framework as presented as well. Everyone content to do that alongside the points that I've summarised. Great, thank you very much, Richard. Very helpful and good to have that formally sort of signed off for now. So we move on. Before we leave the risks section, I would just give Anne an opportunity to highlight any system-wide planning and risk issues that you'd like to do, Anne?
Yes, thank you, Krishni. It certainly feels like we're coming out the depths of winter in the system, which is good news. We had our urgent care board yesterday, and February saw a picture more of some challenging days rather than a full challenging month. And March has certainly seen a better performance for our sort of our offload of ambulances and our ability to move people through the system right out to discharge into our services. So that's been a promising start. We've had some input as a system from NHS England and GIRF to support developments and transformations, which I think has been really helpful and has helped focus us, particularly as an urgent care board, and that will continue. And I think that's important whilst things nationally stay as they are. I think we're not sure what that will look like exactly in the future, but for the moment that will continue, and that's really been supportive. The urgent care plan is being supported through the planning round, and as that sort of moves into what that looks like for contracts for organisations, we can start to mobilise as we get the clarity on that. But for certain, the sort of urgent care risk has been recognised, and we've looked at how to support that through planning round moving forward. So we're in a sense of planning for next winter already, which was what the government's sort of drive was, but we were already doing that. So I think it gets us in a good position for moving into next winter. So that's where we are as a system at the moment regarding winter and urgent care.
Thank you, Anne. Any questions for Anne on that? Okay, just for noting, thank you very much. So we move on to our strategy section of our agenda, and we start with environmental analysis, which is our opportunity just to provide a sort of scan really of what's happening within our local and national areas that we might want to comment on, notwithstanding there are obviously things in various reports that are following. But Angela, anything you'd like to highlight?
Thanks, Krishni. Just a couple of things, as you say, quite a lot's covered in the report, but in terms of national position on staff, I think people will see that the various changes in the report, but just to highlight that as part of that, there was indication around the 50% cuts to integrated care boards. I think important to say at board that we don't have any further information on that. That will be an ongoing piece of work, but obviously that is something that our local integrated care board system partners are dealing with, and clearly kindness and compassion at the time is important, but as soon as we know more, we can obviously have those discussions at boards, because we'll need to understand any implications for ourselves in that. In addition, again, I'm sure board will have seen, but Jim Mackey, as the incoming NHS Chief Executive, is also providing details about his team that's going to help him to transition into the next period. So again, that's coming out and emergent whilst we're operating in this next period. So other than that, I'll wait for the Chief Exec's report. Thanks, Krishni.
Thank you, Angela. Dave, anything you wanted to comment on in relation to health and wellbeing boards, or any other aspects that were relevant?
Thanks, Krishni. If I say a few words on service visits, now that we're beginning to structure the reporting of those through to quality and safety, and then I'll touch on some of the health and wellbeing board. So by end of this quarter, we'll have done well over 30 visits at the end of 24-25. Some really good things being explored amongst teams, some issues that we're picking up, particularly around IT interface issues in our secured services, where we don't run the site and the infrastructure on the site. We're tenants in that sense, but we're working through the implications for teams, and we're doing a detailed review of that through our SEB in the coming months too, so that we can understand the issues and indeed whether there are mitigations that we haven't explored or could be explored differently using different parts of partner organisations. We've had really good evidence of the Together Against Racism work amongst teams, and great to see the posters up in place in all sites that we visited, and similarly the zero tolerance approach being also in evidence across teams, again particularly in some of our secured services where we do have high reporting instances of violence and abuse. In terms of standout issues, the working environments are of pretty high quality, well maintained from most of the visits. There was good team coherence from teams that were visited, and equally the management of comorbidities, long-term conditions has been very strong in sites where the complexity of patient need is such that we are managing multiple needs at any one time. And equally, recruitment remains an ongoing challenge across services, both in medical disciplines and in nursing and AHP disciplines. I'll talk a little bit about that in the integrated organisational report later on. Just on health and wellbeing boards then. So just some changes in West. Sally Burns, who's the Director of Public Health there, and Stuart Lackenby, Adults Social Services, both are taking on roles in Birmingham. And Chloe Gay is the interim DPH for West now, supported by Neil Cox acting as the interim DAS. So just to flag that, as the Directors of Public Health are an important part of the system infrastructure. The things we focus on the Health and Wellbeing Boards this quarter, the health and wellbeing strategies for both unitary authorities are developed and developing, particular focus on deprivation, increased focus on worklessness and employment, and equally, as both local authority areas are subject to improvement plans through SEND inspections, we did take a good look at some of the work that is happening in that space, and both boards took reassurance that the plans are in place, and crucially that they're being co-produced, and we had good presence from family members and parents in the Health and Wellbeing Board to kind of provide a helpful kind of sense check really against how those plans are developing. Also for the board just to be aware of, the Better Care funds for both areas have been signed off. Those are the funds that bring integrated resources across health and care together. And importantly, both boards are endorsing the move towards neighbourhoods with a redesign of some of the locality partnership models that have been in place, trying to consolidate some of those local area networks into a neighbourhood model, spanning kind of 4 or 5 in each local area. And we are moving in lockstep with local authority partners in that work. And we've already done some of our work in CMHTs, which will be covered in the annual report, the annual plan for 25-26. And then finally, just in terms of my role on the board, I will be taking an exec lead responsibility for the mental health stream in the North Hants Health and Wellbeing Board, and obviously working very closely with Anne and Angela in their kind of leadership roles with the collaborative. So that won't be a duplication of work. It'll be much more about streamlining what we're already doing into the health and wellbeing structure. And I'll be taking an exec lead role for social value across both, with us taking a bit of a lead in relation to promoting that, which is even more important considering the financial context that the nation finds itself in. Thanks, Krishni.
Thank you, Dave. Any comments or questions on any of that? Okay, thank you for the update. We move on then to the papers. So first of all, my chair's report, paper E. I'll take the report as read, but just wanted to comment on a couple of things. One is we are going, or I think we're in the process of already going back out to recruit now for an associate NED, or certainly the search has restarted. Just to make colleagues aware, cognizant of the expenditure around these sorts of things, but that there is no cost to us in relation to that search, because that was part of obviously part of an earlier process where we didn't appoint somebody. So we're looking really to conclude that. We've got a long timeline. We're looking to conclude that around June. So if you get asked for support to join stakeholder panel, etc., would be grateful for you taking that opportunity, and we'll obviously look to do that with LPT colleagues. The other thing just to mention is there's a reference to one of the LPT NEDs ending their tenure or choosing not to extend their tenure after 31st of May. And we did therefore talk with NHS England about the opportunity to appoint from within the group, which they supported, and I can confirm that Melanie has now been offered formally the opportunity to join LPT from the 1st of June. So that I can put that in the public domain because that has been confirmed. So I think it's really exciting that the opportunity for us to appoint LPT NEDs and vice versa NHFT NED across the group is a process that we can manage with NHSE and indeed our governors, because obviously it's important that our governors are engaged if it was the other way round. But it is really helpful and I think very welcome. So I'm quite excited about that. So and it's great to be able to use Melanie's expertise across at LPT as well. So just wanted to mention that. And I also wanted to mention that as colleagues are aware, we've been thinking about with Melanie sort of stepping down certainly at the end of the year, but potentially discussions about whether we want to do and make any changes to the SID role or the SID appointment beforehand. We haven't agreed a timeline or haven't finalised the timeline, but just wanted to mention that I'd like to propose at this stage, as colleagues are aware, that UDIT is appointed a SID at a point to be agreed. But if we endorse that now as a board, which governors of our Nominations Remuneration Committee of Governors was also supportive of, it allows UDIT to shadow Melanie through the fun of getting me appraised and all of the other activities that go with that. So I'd like your endorsement of that decision, please, today, which I know colleagues have already indicated their support for, but I thought it was important to put that in to the board formally in public. So I'll take that as approved on the basis of the nods that I'm seeing. And I also just wanted to mention, of the many things, there was, as always, there's a lot of activities highlighted in the report. So commend all colleagues for getting out there and doing all these various things that you're actively involved in, and happy for anyone to come in, any of the NEDs to come in to comment on anything they've done. But I had the opportunity, actually, what was I think most positive, at the invitation of a former governor of ours, David Jones, invited me to speak at the Commonwealth Civil Society Policy Forum, which was talking to people from all over the world, joining an online platform, and with Chris's help, because his team put the slides together for me. It was really all about the journey that we've been on in terms of distributed leadership and all the culture work that we were doing. So I did deliver that. It was only 10 minutes or so, but I did enjoy it. And very sweetly, one of our governors also watched it and dropped me a very nice note to say how much they'd enjoyed it. So I just wanted to mention that, because it was obviously a very unusual opportunity. And it's very positive that one of our former governors encouraged us to take that opportunity. So that's everything in my report. As I say, I'd welcome any comments or questions or anything that NEDs want to add about anything they've been doing. But otherwise, I'll take it that colleagues are happy to support Edith's appointment. Okay, anything anyone wants to highlight or comment on? Melanie?
Well, in actual fact, I just wanted to comment not only on service visits, but also on the Dragon's Den that I attended a couple of weeks ago, because as always, the Dragon's Den is a fantastic opportunity to just see some of the innovation that is being worked on right at the coalface, if you like, at the front line of care, with people from across the services of the organisation coming up with all sorts of ideas, both equipment-based, process-based, but also just in terms of digital. And yet again, it was a rich and thriving sort of melting pot of ideas that we were delighted to support. And Ned regularly attends those, along with Linda was at the last one, and I know Anne attends regularly. So there's always a rich number of people vying with Itai to get onto the audience and the judging panel. So yes, that was good. And also, probably just to say, service visits, as you said, Krishni, a rich vein of insight into the workings of the organisation, the patient experience, and staff well-being as well. And I think for the first time, Julie, if I'm right, we received a service visit report into quality and safety at the last committee, which is a further build on the very robust and resilient process we now run to capture service visit insights and to begin to triangulate them not only as individuals in how we approach board papers, committee papers, and the work across the trust, but also as a quality and safety committee to start to triangulate the findings of service visits to better inform all aspects of quality and safety, and indeed from the perspective of staff wellbeing and performance as well, and sharing those views more widely. So I think that's a really great step forward, and we'll continue to evolve that, I'm sure, and develop the depth and breadth of its perception. Thank you.
Thank you very much, Melanie. I think Judith's been involved in Dragon's Den panel as well, if I remember.
Yes,
so
yes, Melanie and I regularly vie.
Yes, vying for that spot on the panel.
Yeah, we do.
But and the rest of us get to watch it on video, because I think there have been a couple of really good videos sort of illustrating how that works. So it's such a great process and great opportunity, I'm sure, and certainly watching the videos back as I've done, it's great to see the sort of people describing what they put forward, etc. So really positive. So thank you very much. And we'll note the rest of the report. Hand over to Angela now for her Chief Executive's report.
Thanks, Krishni. And start, as always, with big thank yous to everybody. Number of reasons across the whole trust, because the work everybody's doing, clinical, non-clinical, corporate, everybody is continuing to work very hard. Pressures remain, demands are high, and we've also had the planning processes underway, as well as winter, which Anne's already alluded to. So a number of things, too many to mention, but a big thank you to everybody for all of that. We've had obviously the planning period. We're at the last part of it in terms of submissions, but Dave's been leading that with colleagues. And I just want to thank you to Dave and colleagues for all of the work that's gone into that, because it is a mammoth amount of work and continues to be going into 25. To highlight that there are other priorities as well as those that will be important for us that are within the framework, but are not necessarily mentioned in those national headlines. But there's a lot of other targets, performance indicators that are relevant to us as a mental health and community provider. I've mentioned the changes nationally, and again, just to say, Krishni and I also attended recent meetings in London to hear further of the news that was announced at that point, including, as I mentioned before, the integrated care boards, but also the changes for NHS England and its movement into the Department of Health and Social Care. So again, we'll keep the board abreast of those things as we find out further in relation to them as well. We look forward to the 10-year plan. We've mentioned that several times. That is very important and gives, and hopefully, a real step change for the NHS in relation to the 3 shifts that we've spoken about. So again, that'll be something that we'll want to address and consider at the board in due course. In terms of other areas, I'm not going to steal Chris's thunder in terms of the staff survey, but other than to say that a big thank you to everybody. Because to get the response we did is fantastic effort across the whole trust, but also that we can now recognise that's a big staff voice, and it means that what people are saying we can really understand, and we can really understand what we need to do more on. But I'll leave Chris to talk further about that, because he's got a section on that, but it is an encouraging picture. Once again, a thank you for our group strategy, which again is something that it's already been mentioned, but we'll have further information on. A lot of work goes into that, but the fact that it has been co-produced across our group, co-produced within the organisation, with our stakeholders, patients and public, is really important to us, but nevertheless requires a lot of work from our collective team, and in particular strategy and partnership and the communications team, who have really helped and supported us in getting it to its final place. So I really do appreciate the efforts on that. it is really encouraging to see lots of the achievements across the report, and hopefully people have read those. But I just wanted to shout out for being rated joint best mental health trust for food. That's really important. We really welcome and celebrate that, and recognise that we've got some really good staff and colleagues supporting that. And that, of course, is the place-led assessments that are patient-led. So that's really important to us, and we really would want to say thank you and celebrate that across the organisation. There's lots of other things to celebrate, which I say are there for people, and I'll assume they've read. But finally, as you've mentioned already, Krishni, it is Chris Oakes' final board with us, and that marks a significant moment in Chris's career, but also in NHFT's journey, and certainly as chief executive. Chris has worked with me for a significant period of time. You know, I've been chief exec for over 10, probably 11 years now, and Chris has been there for nearly 10, and that's pretty significant. And that's given a lot of stability, and it's also given us a really strong steer on culture, high standards in relation to our people, which we are indebted to Chris for. And I've really, really enjoyed working with Chris. He knows that. We have some really robust discussions, I think it's fair to say, but I have felt absolutely supported in the endeavour to put culture and people first in this organisation. And that's not necessarily something that can be easily achieved. And you have to have good people working on that. And I would really commend Chris's role in that. We will be indebted to him for that journey over such a significant period of time. I know it's going to be hard for Chris to leave, although I'm sure he's, after nearly 40 years in healthcare, ready for a little bit of a break. But I have no doubt that Chris will continue to add his role and his expertise, in particularly in the world of organisational development, which we have been the recipient of as well. And I know that I'm sure he'll be thinking about opportunities in that too. But we really do wish Chris well. We are, as I say, ever thankful for the work that he's done and the hard work that he's put in. And I'm personally very grateful for having had the time spent working with Chris. And if I reflected on my career, I would always value that era with Chris. So a really high thanks indeed. And just to say that as part of that arrangement, we are embarking on an acting up position, an interim arrangement, and Dion, who's with us at board today, is going to be acting as that interim director of people. And we also look forward to working with Dion in that role. And I know that she will embrace that with as much vigour and want to be as committed as ever to the cultural journey that we have within NHFT. Thanks, Krishni.
Thanks, Angela. Well, I mean, I won't repeat all of that, but just to echo everything that Angela said. I mean, I've only, Chris was here when I started. So, and I think the very first day of my life as chair in Northamptonshire Healthcare was a leadership event introducing the leadership behaviours. So I've known nothing other than a huge focus on culture and the right kinds of behaviours, and actually it's been an incredibly, I think as one of our former NEDs said to me, to actually see some of that coming to life. You know, many of us talk about culture and the importance of staff engagement and all the investment in and focus on that. And to actually see it materializing, not just in delivery, but in actually affecting performance and improving performance, has been an incredible journey to be part of. So, Chris, thank you for driving that. I know it's a team effort, but I think you've brought your expertise to that in a way that I'm not sure has been easily achieved in other settings. So. And of course, for your personal support on some challenging governance issues that Richard and you and I have had to manage along the way. And that's been incredibly helpful. So I would just add my thoughts to that, really. So I don't know if you want to say anything, Chris. I'll give you that opportunity as we're here.
Yeah, no, thank you for both Angela and your kind words. And equally, I've enjoyed working with Angela. I think we have achieved a huge amount. I think the trust on its culture journey and its leadership journey is ahead of the pack or leading the pack. You know, we see that from conferences we go to and what we achieve. And I think, again, as Angela said in the staff survey, I'd like to thank everybody. It's been great working with everybody. And it's a great team. I would reflect with Angela, though. It's interesting. The only exec colleague that's still here from when I started is Angela. The whole exec team has changed in the course of that. And I think I've been involved in appointing everybody who's here. So that's interesting. And equally, none of the non-exec directors who were here when I started and the chair at the time are here. So it has been a change over time, and it's just under 10 years that I'll do. But I think the trust has been done brilliantly. I think it is challenging for everyone. I think I was talking to Andrew, it's increased as I've been here, but I think we've achieved some amazing things. And I think probably my proudest moment is when we achieved the National Chartered Institute Personnel and Development Award as the best employer experience. That wasn't an NHS award, that was a national award against all the private sector companies and everybody, and we were the #1 in the country on that, and I thought that was amazing. Alongside, obviously, we'd won the HSG Trust of the Year, and we won the same thing from HSJ, but I think that was a recognition of our work on leadership behaviours and distributed leadership. And as you said, Krishni, people are still interested, and we're still building on it and sharing it. So I've really enjoyed it, and thank everybody, and wish good luck to everybody. I hope maybe there'll be some opportunities for me to come back and do some things to support at different times, but certainly a good break is something I'm looking forward to, as it has been, 40 years, I can't believe it, but time for a bit of a break maybe. But thank you to everybody.
Thank you, Chris. Thank you. Okay, just conscious, are there any questions or comments on Angela's report that anyone wants to highlight? No, so happy to receive that, and we definitely record our thanks formally to you, Chris, for all the reasons we've said. So I think
I'd just like to say, Krishni, I forgot that. I'd like to thank the various people who've worked in the People Directorate who supported me with that and have been a huge support to me and the others, because as Angela often says, that, you know, it's all about the team, and certainly success we've had. I know I've been leading that, but you can't do it without people to support you. Just like working with execs is great. It's been great to have the team there.
Yeah, brilliant. Thank you. Okay, well, we'll note the Chief Executive's report and the updates within that, and hand over to David for our new group strategy, Paper G.
Lovely. Thank you, Krishni, and thanks, everybody. So we brought today our Thrive strategy here, which has been about a year in the making of engaging with people, understanding, and as Angela touched on earlier, that co-production of both staff, people with lived experience, ourselves through the board workshops across both LPT and NHFT, and also our stakeholders. So just to, I was really conscious that I could talk about it for ages now, having been working on it for a year and taking it forward, but very briefly, the kind of key things that we've got there is the new vision. Together we thrive, building compassionate care and well-being for all, with a new mission of making a difference together. And the together bit, just wanted to reinforce, has come around from conversations about together being with staff and service users, their families, their carers, together being inside teams, across teams inside NHFT, and then also together with LPT and NHFT, and of course, together with stakeholders. We've talked about the REACH partnership and other organisations today. So that together is a multi-meaning word reflecting all of the different ways that we work together with others and build things through. In terms of key priorities and building the strategy together, we've taken into account everything around local system plans, so the ICB 5-year plan, the ICB 10-year plan, the ICP 10-year plan, and also the NHS England plan, and expected to come out and built all of that in together. We've got the whole strategy in front of you today for that final approval. We do also have a comms plan, a way of taking it forward. Dion's been working all of that up. We'll then launch it softly at the next week, and then going into a harder launch the week after, just to reflect that the strategy starts at the beginning on the 1st of April. I just felt that we wouldn't launch our strategy on April Fool's Day. We would just take a little bit of time to roll that out and feed that through. So it is here, and I think Angela very nicely summed up. This is a year's worth of work. To some extent, the hard bit starts from here, and this is also about the engagement of the strategy, how we use it, and that measure of success of thinking. DigBQ was something that was well embedded in our organisation, and actually what we want to do is to help people understand the story of evolving from DigBQ to Thrive, and then ensuring that Thrive is as embedded in our organisation as DigBQ was. And that becomes all of us as a board responsibility through our senior leaders, through our team, so that everybody understands it. And that's all included in part of the comms plan that Dion's been working with strategy and partnerships to develop and move forward.
Okay, thank you, David. So obviously this is something we've been very engaged with in our various development workshops as well, but opportunity for any comments or questions. Melanie first, please.
Yes, David, as you say, been involved on many occasions across the course of the 12 months, and so exciting to see the final sort of product come out. And I just reflect on the conversation we had at the last development workshop, where you asked, you know, what might be a good size and sort of representation of the strategy in a form that could be digested and that people could follow and that we could clearly talk about. And I just want to say, I think you've hit the nail on the head. I think the document is exceptional. One of the simplest, most concise, and yet profound documents in terms of our strategy for the next 5 years. And I just commend the work of yourself and the team, not only in the whole year's worth of effort to pull the strategy together, but then also in distilling all of that work down into something that is so simple, so concise, and so representative. So thank you.
Thanks, Melanie. Tim?
Yeah, I echo everything Melanie's just said, actually, about the document. I think it's a brilliant piece of work, David. The only question I've got today is when we launch new strategies, everyone gets very excited about the new, but people aren't very good at decommissioning the old. And we need to be explicit on removing the materials, taking them off the system. In my own ICB, they still have a document which was 5 years old on their website, which hasn't gone, about the old strategy. And we need to be really disciplined about saying we've completed DigBQ, Leicestershire's changed. This is the new strategy. We just need to be explicit on that point as well.
Absolutely, Tim. And I mean, Dion, I was watching you nod. I mean, you'll be most welcome to reply if you'd like to here, because you and I have been talking about that.
Yeah, I think absolutely. We've got an incredibly comprehensive plan which lists not only new materials and things that we need to do across both trusts, but also focuses very much on how we do that across the group and make sure that all of the information is aligned and updated as needed. So we've got a plan for that, which a lot of that includes a lot of trips around the trust, checking notice boards and taking down banners and all of that. So it is all in the planning. It's already starting.
Thanks, Dion. Perfect.
And in fact, you know, we did so much work on it. That's probably the effectiveness of, say, 5, 4, 3, 2, 1 and all the other elements that launched our strategy was so good that actually there's probably more work to do to make sure that it is, you know, everything is sort of reviewed and refreshed appropriately. So, but we've certainly done that effectively in the past. So I shall take it that our track record on doing these things is pretty good, really. But an important point to make sure it's there, and great feedback as well from Melanie and Tim on the document. Edith?
Thank you. Well, because I was so slow on the draw this morning, Tim and Melanie have now stolen my 2 points. However, what I did just want to say in addition to what they've already said is, in comparison to some other boards that I work with, this process has really been the most inclusive and, from my point of view, the least painful. So I would really commend you and the team for that, because I think it does need to be recognised. And I very much look forward to working with you all with the new strategy in place. Thank you.
Thank you. So great feedback, David, and I think a great positive endorsement of the process of putting it all together and the work that was done. So thank you. Did you want to come back in?
Well, all I wanted to say was to say thank you very much, but also just to recognise that bringing everything together across both organisations while led by strategy and partnership involved an awful lot of people, big input from both comms teams and ways of working through. But just to give you an example of one of the added and wider benefits, we've had a steering group meeting to develop the strategy, a meeting on a fortnightly basis and working things through. That's included people like Richard, it's included HR reps and colleagues like that. And that's been bringing people across both organisations together to thinking about things. And the outcome at the natural end of that strategy would be to finish that group and close it down. And actually colleagues have sat down and said, actually, there is purpose and there is benefit in meeting on a monthly basis to think about wider bits and other opportunities and ways of going. So it's taken and it's started to get a grip. And I thought that was just a useful example of how these things, while if you want are about producing a document, an outcome, an output to do something, and then that delivery of that strategy, it also has brought people together across our organisations. So it's been a lovely experience, which, while being led by strategy and partnerships, has had a lot of input from everybody else.
Okay, so thank you, David. So you're asking the board to formally approve the strategy, which I take it colleagues are happy to do. So thank you, and we take it forward as described. And we have, in fact, our next item in any case is our annual operating plan, which is led by Dave, item H.
Thanks, Krishni. So just briefly on this, I won't go through the pack, but it begins to bring life to some of the detail that we've described in terms of the Thrive strategy. So as a trust, we're required to publish an annual plan that describes our focus for the years ahead. And this does link with the conversations we've been having about the wider system plan over the last few weeks. And I know things are running to the wire in terms of submissions on those, but it doesn't materially change what is in here. It still remains aligned in that sense. So it aligns to the group strategy. We've got 6 priorities, which the plan is articulated against. And again, many thanks to the teams for their contribution to making that seamless and telling a story in that sense. The emphasis on digital is pretty important, not least because it's one of the national shifts, but equally we describe it in the document as being one of the foundation stones of kind of our next phase of work over the next year and into 29-30. Partnership working is also alive and well throughout the document, with a particular focus on social value and additionality at a local level, focusing, as I said previously, on neighbourhoods as being one of the key building blocks and delivery enablers for what we do with partners in the Northamptonshire system. There's a big focus on community, and the overall theme of the plan for this year is community first, so emphasising the role of communities and individuals, and again focusing on co-production and person-centred care being a key pillar of the work going forward. Children and young people also play a massive part in this document, and that aligns with what we're trying to influence in the system, with ensuring children and young people services are prioritised, and we feel that's been heard at the system. We've yet to see it kind of articulated potentially through services, but for us at least, we're putting it front and centre, and the risks that we carry forward from COVID remain live in our planning in that sense. You'd expect it to include a valuing people section, which it does, people being the centre of what we do, inclusivity, compassion and empathy being part of the framework that we're applying. We're keeping alive the compassion commitment. We realise that's had a good impact for teams, and the compassion champion approach is well received now across the trust, and we're going to build on that going forward along with our principles on kindness. Of course, in line with the value programme, the efficient and effective approach for the plan is alive and well. We will have a value programme meeting weekly, which we've had to date, which has been successfully helping us deliver that part of the organisation's strategy. That will have a renewed emphasis going into 25-26, and as I say, I feel a certain amount of confidence that these are paths that we've followed to date that have had results, and I think the framework of neighbourhoods, communities, focusing on people, an emphasis on compassion and person-centred care is the right way to approach the challenges set out before us for 25-26. And then finally, quality improvement is central to this too, and builds on the person-centred care aspect of our work, but also talks about continuous improvement within the organisation as being something that helps us navigate challenges as they emerge. And we are a very agile organisation in that sense. So a quality improvement framework across everything we do, I think, will stand us in good stead as we drive towards the Thrive strategy into 29-30, as David outlined. So I'm asking the board to approve this plan. It will be a public document. It will go live on our website, and in due course, it'll be part of the statutory submission to Parliament.
Thank you very much, Dave. Melanie, please.
Well, at the risk of sounding boringly repetitive, I just wanted to commend Dave and everyone again on a really clear plan. And I think that what the plan does is also just remind us again of the complexity of the environment in which we work, the huge span of partnerships and engagement and opportunity that exists actually as we seek to help that shift towards the community and towards digital in particular. As always, you know, the proof of the pudding will be in the delivery, and I look forward to seeing at the continuing boards and potentially in some committees as we look at subsets maybe how we drive progress against this plan, and, you know, as always, challenging the method and the sort of process by which we actually as a board get a good assessment of progress and obstacles, and reflect that within our risk register and our assurance processes as well. So I look forward to seeing the plan come to life really throughout everything that we do in order to help us deliver it.
Thank you, Melanie. Any other comments or reflections? Okay, is the board then happy to approve the annual plan as Dave has described? So we have two sort of complementary documents, our overall strategy and our annual plan. So thank you. I'll take that as an approval. And thank you, Dave, for talking us through that. And again, for all the work that's been done, that clearly needs to be recognised. So thank you. We move on then to our integrated performance section and start, first of all, with the AAA report from the Performance Committee. So Judith, please.
Thank you very much. I'll take the report as read. I'll just highlight a couple of points from it for the board. Under advised, we again have the financial performance, which 3 weeks ago we were looking at month 10. Clearly, things have moved on from that, and we're potentially looking at month 11. However, we had an improved run rate and we had, and we had an improvement in agency spend as well, which had a very positive impact on our financial performance. The finance team continued to work on the value programme, and although there is a small gap remaining, there is some optimism that that will be closed. Now, if I may just say at this stage that there was a discussion during the committee whether we should not have the financial performance both under advised but also at Celebrate outstanding, because of the absolutely sterling work that the entire organisation and the finance team specifically have done to bring us to this stage. However, at the plea of Paul, we a little bit of superstition thrown in there. He said we're not quite there yet, so let's just wait. But I just wanted to recognise, I want at this level in public, the sheer amount of work that has gone into the work so far. Under advised, we also have the Green Plan refresh. Currently, we don't have an active green plan frankly, for national reasons, because the NHSC guidance was only recently published. However, the exciting plan is that there is a project plan in place to refresh the green plan, and that both the Chief Medical Officer and the Chief Nurse will be involved to really get a bottom-up approach and buy-in from our staff to ensure successful delivery. And I'm certainly very much looking forward to seeing that. Under Assure, we heard a very detailed update from the Integrated Organisational Report, which I will not address because that's the next paper on the agenda. And also, we had a discussion around the planning and value programme for the coming up financial year, and the focus on the 3 shifts and the efficiency targets that we're likely to meet. So we're very aware at committee level and definitely have a very keen eye on how that's going to be achieved. Finally, I did just want to spend a little bit of time to celebrate the outstanding, because we heard an overview of access to services and waitlist management, and the committee heard a really excellent update as to what the team are doing to ensure and manage the wait lists that we've already heard, if I may just sort of cast my mind back, from the CAMS service earlier in this meeting. However, we focused on specialist nursing, adult ADHD and children's ASD ADHD service, with some really phenomenal and very detailed, granular work that the team are helping the service to do to manage wait lists and manage and to ensure that that if you like, patients are waiting well within the remit that we can offer. So really just want to recommend the team and really sort of congratulate them for the amount of work that they're doing and really mirroring NHFT values. Really happy to take any questions on that, but those are the points I would want to bring out. Thank you.
Thank you, Judith. Any comments or questions anyone wants to raise at all about the report? I know we've got the integrated organisational report, sort of updated version, coming next, but there are some really positive assurances in that report, particularly around waiting times and standards, for example, being met in quality and safety terms. So important for us to note, I think. So thank you, Judith, for that. We move on then to paper J, which is the integrated organisational report for March. So over to you, Dave.
Thanks, Krishni, and thanks, Judith, for the summary. I won't. Chris is obviously going to talk through some of the staff service. I'm not going to focus on workforce, particularly in this segment. Linda will also cover quality. I will ask Anne and Paul, though, to make a contribution as I go through, just in terms of operations and finance where relevant. So we've outlined the planning round entering its final phase, and submissions through via ICB continue, and we are working towards a break-even position as a trust, which Paul no doubt will comment on. The IOR in that sense reflects the best position we've been able to get to in terms of performance vis-a-vis investments and resources available in the context that we're working in. Waiting times, as you did outlined, we did have a great presentation from Janisa on our trust waiting lists, and it's up 1.5% from last month, but we are seeing corresponding improvements in terms of numbers of people waiting within 18 weeks. So we've had the third consecutive month that the 92% standard has been met, which now indicates a trend, and hopefully that will continue. We'll have, of course, task and finish groups within the 7 services where waiting lists are challenged. That's part of the recovery post-COVID, and work in those continues to improve, along with investment cases now being realised, particularly in speech and language therapies. Recruitment has commenced in those areas. Chris, as I said, we'll talk about workforce as we work our way through the agenda after the break. Quality and safety, we are seeing within control limits, patient safety instances remaining in that space, and all significant incidents being reviewed through the ROSE process, which is our review of significant events, with a response plan scheduled for review in June 2025, which will give us and Quality Committee an opportunity to review the implementation period that we've had with the patient safety incident framework. In terms of friends and family tests, we've seen some good results from staff recommending place to work in the staff survey, which is outlined on the first page, but we are seeing a dip in a recommendation as place to care. It hasn't reached a trend as yet, so we are monitoring that very carefully, and we've got a number of actions in place to understand that and get ahead of any issues, and crucially get the deployment of Equivia across the organisation widely adopted, because that has the biggest impact in terms of the empirical nature of the data that we look at. So work continues on that, and that is a focus for us over Q1 going into next year. In terms of finances, we've obviously had discussions earlier this week last week rather, on Friday, in relation to the system financial plan. We continue to forecast a delivery against our finance plan, and we're entering into 25-26 with a break-even plan, albeit with a significant cost improvement programme underpinning that, which we will be getting underway and continuing, frankly, as I said, on a weekly basis through the value programme. In terms of children and adults care, we've had 5.7% of our wait list. The benchmark is slightly lower at 5.5%. We're continuing to see improvements in that area, particularly in eating disorder services, and we will be looking to make sure that's a consistent approach into 25-26, and that's outlined in the plan which we just reviewed. The integrated response team continued to make great strides, and this is such a significant contributor to the system pressures in relation to supporting EMAS and the front door of A&E with community intermediate care-based services, and to have a response rate at 83% in February, again, is just a really strong indication of how our services support wider health services within the Northamptonshire system. Equally, our length of stay work both in adult community beds and in our mental health beds is showing great gains in that sense, and we've put into our plan a consistent expectation that we would get within benchmarks for length of stay across those services, and you'll see the trajectory that we forecast. And again, that's so important to the value programme piece of work, because where we're able to provide people with a bed locally, that avoids us having to expend resources, financial resources, in out-of-area beds. And of course, care is better for people. They're closer to home and in their familiar environment. So that's a really critical part of our plans going forward. Mental health, learning disability, and autism and security services. Again, these are detailed strongly in the plan in terms of the work that we're doing. Critical focus for us over Q1 are outcomes and SNOMED reporting, so that data quality within those services. And that's really important, because productivity is going to be an absolute must-do, as we know, into 25-26. So the stronger and better quality our data is, the better able we are to assess whether our services are being productive in line with expectations. So again, we're on this, and it's, as I say, a focus for Q1 across all service areas. I'll pause there, Krishna. Maybe if I could just take a moment just for Anne, if you anything particularly you wanted to draw to the board's attention, and equally Paul, in terms of finances.
Yeah, I was just going to raise just on that productivity bit. I think we've done a lot of work on waitlist management, as was described in the performance committee and Joe's reference in the comments. And this very well prepared work, we're looking to model that into some more productivity sessions. What we've found is that by the way that waitlists are working in services is that people are really taking them on as part of their core piece of what they do. They want to look at how they can work differently. I've been out to see teams just this week. I saw the older person services and the memory assessment clinic. They're really owning the the pressures they've had from COVID, and what can we do differently to make a difference for patients and also look after staff in that process. So we'll be hearing more about that alongside our waitlist management, and Janice is going to be taking a lead on that for us, which I think is a really good next step for her.
Thank you, Anne. Paul, did you want to come in as well?
Yeah, just to follow on from that, Christian, if I may, and that work that Anne's describing on productivity, we can see the benefits that it has for patients, because it does reduce waiting lists. We're seeing the patients that we need to see in the right orders, and we are speeding up care for people as well. So that productivity, we have to really connect, and I think teams are really connected to our patients and the people who need to be seen through our services. What that does, of course, is then contributes to the savings programme as well through 25-26. We know we've got a big challenge, as the rest of the NHS does, in that sense. So very much productivity will help us release cash from the organisation whilst improving things for patients, which is the entire ethos of our value programme in any case. And just very quickly to draw out from the paper about where we were at month 11, I realise that we're 4 days away from the end of the year, so I'm pleased to say that no one's flagged any bumps in the road since this was written, and indeed that we talked to Performance Committee. We're as good as bang on plan at month 11, and as Judith has already said, we expect to be at break even, albeit that I'd like to get to break even before we do any sort of recognition of that. The value programme, we've caught up a great deal over the last 2 or 3 months, and again, to echo what's already been said about the efforts of everybody up and down the organisation to do that, I think it genuinely is remarkable that we've been able to get this far with that. A big part of it is agency, as has already been stated, but I just wanted to mention about the reason that we can report this at month 11 and our run rate. We started last financial year with a run rate of nearly £1 million loss per month. We start the new financial year with a run rate which is at break even. We've still got work to do, and the challenges are big, but nevertheless that turnaround is significant from just in the last 12 months. Thank you, Christian.
Thank you, Paul. That is a very important point, I think, to note, really, because that is, an enormous achievement. I know we don't want to sort of say we've ticked the final box of concluding the break-even position, but to improve the run rate so significantly is it's a huge improvement, and a great testament to all the work that's been done. So I would certainly support Judith's desire to congratulate colleagues for that, because that alone is a significant achievement, and is really important for us in coming into the new financial year, which is going to be no less challenging, as we know, and in fact more challenging. But I think the other point, Paul, which was really important, is it can sometimes sound a little bit motherhood and apple pie to say, well, we can improve things, we can make savings and improve things for our patients, but I think some of the illustrations that you and Anne have provided do indicate that, really, that we can, by managing, and it's coming through really clearly, the work that's being done on waitlist management that obviously Neds have obviously seen this presentation on, and we've had Janisa come to talk to us at one of our development sessions also actually about the benefits in terms of managing DNAs, for example, because that was another one where we talked very clearly about it's better for our patients and better for us if we can avoid DNA. So all these things are really, really important. So thank you for highlighting that. Just want to invite any other comments or questions regarding a very comprehensive organisational report. So Julia first, please.
Thanks, Rishni. I just wanted to add in from a quality perspective around the really strong and robust quality impact assessments that underpin the value programme. And we certainly looked at some of that I'll come on to it in the Q&S report shortly, but in our workshop when we looked about productivity and the potential impact to quality and risk, but we had it described very clearly, the EQIA excuse me, process led by both Linda and Itai. And I think it's really important to say that, because while we're in challenging times with these financial decisions we're having to make, actually the quality issues and considerations and assessments completely underpin that whole process. So just wanted to add that in. Thanks.
Thank you, Julia, and I'm sure that is an important assurance to provide, particularly to members of the public who might be concerned, and indeed our governors, about the nature of the challenge that we face. Chris, please.
Did you want to go through any of the workforce stuff or take it as a read?
We've got a people section.
Yeah, I'm not going through this report in that section though. That's just about the staff survey. It's not about our metrics.
Yeah, so obviously staff survey, I think we'll pick up separately, won't we? Because we've got an item on that. But if there is anything on workforce, other areas of workforce, Chris, that you wanted to highlight?
Just a quick highlight that the vacancies are at a low level that's feeding the agency, and that is the lowest level it's been for 3 years, which is worth us all noting. It feeds everything we're talking about. Just to flag on the turnover as well, that we have taken through SEB. We've talked about it before, using the exclusions approach, because that's what others are doing. So that would be the 9.6, which is positive. The appraisal is 1% below, but that is an issue with corporate that we are addressing and taking forward to improve, and obviously a welcome reduction in sickness from 6.2 to 5.6%. And People Committee are aware that we've got a real focus of a project on that, focusing on policy, training, a whole range of things to really improve the position. But I think those are the highlights, Krishna.
Great, thank you, Chris. I just had one question, and I know, Dave, that you said it perhaps not yet quite a trend, but that reduction below the current target of recommending NHFT as a place for care, which I'm assuming comes through IQVIA. I suppose just wondered whether there is is the 90% the national target? Is there still a national target? It's one of those areas where I just wasn't absolutely clear. And I suppose my slight worry is in the kind of current constraints. Is that something we're going to see more of? You know, do we need to prepare ourselves for patients feeling that, you know, some of our it's not access to services particularly, but that their patient experience might be compromised in any way? So I don't know, it's probably a difficult question to answer, Dave or Linda, but I was just concerned about that drop and whether that is something that we might anticipate we're going to struggle with.
I mean, I guess the key thing is that there's been a number of months now where we've seen a bit of a dip. So the trend, even if the target is slightly different, the trend is the thing that we kind of need to understand what's moving that. And undoubtedly, the fact that IQVIA, it is across the organisation, but it is still being embedded within services, and we still have pockets of places that use it well, other places that don't. So we have to get that to a good position. And then there is the patient engagement team, and Linda will comment on this in terms of the strategy that we're using to raise awareness of as a feedback tool and have that live information. So where it works really well, if I think about MSK, that kind of really live feedback that staff get helps them adjust care in a sense that makes it feel much more person-centered rather than a passive exercise that people do post-event. So there's an approach here that I think we can optimise for Equivia, and we'll come back and we'll pick it up through Q&S because I've asked for further work to look at the themes that are emerging. So we'll bring that through to see whether there's some specific issues that we could address through service visits and other approaches that we're using through the plan for June.
Thanks, Dave. Linda, did you want to come in?
Yeah, thank you, Krishna. I just wanted to mention that Hugh Jones, who was our feedback manager, had been with the trust several years, so he retired and left. And we did have a break in Chris joining us, so he's now in the team with a plan to pick up from where Hugh was, because Hugh used to go out into the service, particularly when you support some of our staff who've just joined the teams. So if you consider, say, a Band 5 nurse who's on the ward, they may not be confident enough and think, if I happen to ask this person to give feedback, they're talking about me rather than. So Hugh used to do quite a lot of that work, which we've already put in plan. Additionally, we recognize that QR codes are very popular as a method of giving us feedback. So we're just going out, even on our service visits, just to look to see that those QR codes are visible for patients and users of services, because we've seen that there's a real uptake in feeding back in that way, whilst we do the further rollout of SMS text messaging. So we do have a plan in place. We are monitoring this and absolutely recognize that we have had a dip. However, the messaging around us getting feedback is going right around the organization. Patients, staff, lived experience, experts, everyone is starting to understand why we require to capture that feedback, and that all feedback is feedback that supports us to run effective, safe, good quality of services. So we really value the feedback that we receive, but we do have a plan, and we'll go back to Quality and Safety Committee to provide that assurance. Thank you, Chair.
Thank you. That's helpful, I think, to just get some assurance around the actions that have been taken and noting the work that's ongoing to, I guess, increase uptake and make sure we've got the as broad a range of feedback across all our services as we can get. And the important point, I think, is the responsiveness then to the feedback of individual services. And certainly I was aware that Hugh had retired. He was certainly very active in that space, wasn't he? So it is important that we continue that work, because it is a really helpful tool, as you've described, both Linda and Dave. So thank you. So the board is asked to just note the report and review performance areas of risk, which we've done. And I think that brings us to the close of our integrated performance section. So I make it just 11:26. So if we can take 10 minutes to have a short comfort break and be back together at around 11:35, that would be great. And we can continue with our meeting. Thanks, everybody.
Thanks, Krishna.
So if we're ready to go, I suggest we make a start. So we're moving on to the quality section of our agenda, and we start with our AAA report from the Quality and Safety Committee. So Julia, over to you.
Thanks, Krishni. So we'll take the report as read, just to highlight one or two areas. You'll see the areas of ongoing monitoring under the advised section. A couple of our quality priorities for the year. There were some challenges with those, and they're described there. And the quality account, actually, which we publish very shortly, I think early end of May, beginning of June, will actually have much more detail for the public to actually see all the details of our quality priorities and how we've performed. And the Quality, Safety and Assurance Group brought us a number of areas of escalation, which we looked at some of the mitigations, but there were some gaps in assurance, so we've kept a few of those as ongoing monitoring. In the Assure section, you'll see it's quite a lengthy, detailed section this time, and that's because we had a full hour focus session on assurance around our community mental health teams. And that was, I think we mentioned this and signalled it at the last board, in response to the Nottinghamshire CQC report, the Section 48 report, we put in a robust response, an assessment against our own teams, against the findings of that. And we felt it would be really good assurance, a good time to go through a number of those actions, a number of the recommendations of the report, and look at our own teams. And you'll see a huge range of areas that we looked at, and some of the detail, and we took very strong assurance from the information that was presented by both Linda and Itai, and the ongoing work for a significant transformation that's happening within those teams. And again, we've detailed that so that that's open and transparent and people can see the work that's ongoing. And we will have some periodic updates on progress and outcomes as time goes on for that. Just wanted to highlight the first appendix is the AAA report from the patient experience team around complaints, PALS involvement and feedback. And we've just been talking about IQVIA, and some of that detail is in that report. And that's because the board delegated QNS to monitor this ongoing from April this year. We've taken that report and have added it as an appendix so that it just completes the year, but actually from April we'll just have highlights through this report. So the risk section, just note the end of year position for our 3 BAF risks that we monitor and the proposed alignment to our new Thrive strategy, which we just approved. That will come back in due course. Appendix 2 is the Quality and Safety Committee workshop that we had in February, a summary. And that was about falls prevention and promoting safe mobility, and as already mentioned, understanding efficiency and the impact or risk to quality and safety. And we had really extensive presentations from the falls from Linda and on our efficiency from Paul. So we thank them for those, and we took, again, strong assurance around the process for our value programme that's going on at the moment. Just to pull out that we've already mentioned the structured service visits report. That's the first time we'd received that and absolutely commended that. We really appreciated that, and thanks to Dave and his team for bringing it. And we recognise that it's a maturing report. He was very welcoming of some suggestions going forward to improve it. And it's going to be a key triangulation point, I think, for us, not only for Quality and Safety Committee, but for other committees across the Trust, to be able to bring formally some of that feedback, themes and trends from visits, and also to then proactively look at service visits going forward and where we could focus our efforts and energies, particularly from a quality and safety point of view. And then just to commend the Celebrating Outstanding section, as always, mostly highlighted from the Quality, Safety and Assurance group. And I'm happy to take any questions unless anybody's got anything to add. Who was there?
Thanks, Julia. Any questions or comments for Julia regarding the report? No, thank you, Julia. I mean, I think really there's a lot of really important points, I think, in your report, Julia. So I wanted to say thank you for particularly around the CMHT aspect. But also I thought it was really helpful to there's a bullet point in there about the patient, the disengagement and concerns about disengagement, which we I know discussed at various sessions, didn't we? And I think it'd be really helpful. The committee's obviously requested further updates on how that's working in practice, but I think it'd be really helpful to receive that assurance through these reports as well in the future, because I know that was an area of concern for the board, and rightly, because it was the key, one of the things we felt was the big learning from the Nottinghamshire experience. So thank you for that. Great report and lots of very important information within it. So we move on to the Patient Safety and Learning Assurance Report for January and February, paper L. Over to Linda, please.
Thank you, Krishni. Just to say that we took on feedback from those in Quality and Safety Committee. So our report now clearly states the reporting period that we cover within the report. This was on the back of us being mindful that information that's then reported through the integrated organizational report will be ahead of this timescale. So we just had to make sure that our information aligns really well, because some of the information reports ahead or slightly behind. So we've clarified that. I'll take the report as read. Certainly, as you can see, we continue to report on our 5 top safety issues and the work that we are doing around this, the monitoring and reviewing of these incidents. Also of note, just to highlight to colleagues with regards to patient safety incidents, as you'll see, we're still monitoring with regards to violence and aggression, which was discussed widely in previous sessions, even in our Quality and Safety Committee, but seeing a reduction in those incidents rather than a steep increase. Wanted to just make a note of the work that we have done through our review of serious events, significant events forum, where we've provided information on our cases that have been presented to the forum and the outcomes of those. So we've actually given you a summary of that, where there's been no further review that's directed, and those where there's a patient safety incident investigation that's been directed, structured judgment review. We've given you information on that within the reports. Further work is being done, and as Dave mentioned earlier, we are due to review our piece of plan, which we launched now and has been operating for a year. Also, we've been part of the research that has been carried out nationally to review the impacts of PSERF. This was directed by researchers from Leeds University, and as we were one of the early adopters, we've been part of that too. I'm asking the board to note the report and also be assured around the work that we're doing. Special mention of Patient Safety Awareness Week, which we had in March. So that will be reported certainly in the next report, but didn't want to miss an opportunity of sharing this. And a huge thanks to our comms team who supported us in actually raising awareness of that throughout the week, which was the 9th to the 15th of March. Also wanted to mention that within NHFT, we did have 3 staff were nominated to participate in the NHS England Level 3, Level 4 Patient Safety Syllabus training, which was delivered by Loughborough University. So myself and Richard Amponsa have successfully completed the program, over 100 hours of study time, face-to-face days, and part of that program then we've done the learning around the tools that are used to support us to embed PSERF. So I'm pleased to say I'm now a patient safety specialist for the organization. So I'm happy to take any comments, questions. Thank you, Chair.
That's very positive, Linda. So congratulations, and that sounds like a lot of effort, but a very important focus. And thank you for investing the time in that. I think it's really important that you and Richard have taken that on. So thank you. So any questions or comments regarding anything in the report? Robin?
Just very briefly, Linda, could you just add a little bit more about the thematic review into the 136, or I'm not quite clear what it actually is in terms of the 4 thematic reviews. One of them is into people being admitted via 136 admissions. I wasn't quite clear what that one is. Can you just say a little bit more about that?
Thank you, Robin. So what happened with our 136 suites is that we have 2 136 suites places of safety, and we had a situation where when both rooms are utilized and patients are having to wait, we needed to establish, are they waiting safely, where are they waiting, and actually, is that the right place they are waiting? So we were concerned around those waiting times, so we needed to understand them. We also wanted to look into, have there been any incidents when patients have been in those settings? So looking at things like access to their medications in a timely manner, has there been delays in having Mental Health Act assessment? So there's various themes that we were looking at to try and understand that and learn through that. So that's one of the thematic reviews, and certainly can share with you terms of reference around that if it helps.
Thank you very much, Linda. Any other comments or questions? Okay, so thank you, Linda. We'll receive the report, and if we could ask you to circulate, possibly it may be useful to Julia and Robin, the terms of reference around the thematic review. That would be great. And other than that, I think we're just asked to note that and take assurance from the report, and that there's, as always, a great deal of very useful information in there about all of the trends and work that's ongoing. We move on then to paper M, which is the Workforce Safeguards report. So back to you, Linda, on that.
Thank you, Krishni. Just to mention that the patient safety report was reviewed in the patient safety group ahead of Trust Board, and our monitoring Workforce Safeguards Board paper, this is reviewed within the People Committee, where we present it on a bi-monthly basis, then updated to bring it to Trust Board. I will take it that the information has been read. We were asked to provide further breakdown detail for medics, which we have done in this report, so hopefully that's helpful. I'll talk more to our reports on staffing that we provide monthly through Unify, which is a national portal where we update our information on our staffing numbers. We have had areas with below 90% occupancy, and I'll just like to assure Board that when we've had this, we've looked at what cover has been provided. We look at information triangulating from incidents as well as what we have on our e-roster. So there's been several things done to support. Some of those include a skill mix where other professionals, clinicians are then supporting. We've also had staff like our ward matrons, our clinical team leaders, then cover those gaps on the floor, which has been very useful. And certainly we've not had incidents that we want to report that the wards have been unsafe. Some of the wards that we've detailed have had lower occupancy numbers, and the staffing is reflective of that, and that's been provided within the report. We continue to monitor any incidents where there's been reports of lower staffing numbers, and that's picked up through our weekly triangulation and also follow-on meetings with the specific directors for those areas. With regards to establishment reviews, if you remember, Chair and Board, I did mention that we'd completed these and we're writing them up. We are not proposing a change in our establishments at this time because we've done a lot of work around what we currently have. We've looked at skill mixes and additional support that comes into the areas, and therefore we're not recommending or proposing changes to the current staffing establishments. We've had this reviewed in several groups and committees, including as the last stop through our value program, where when we've made changes, clearly we've also gone back to state what those were. Any other changes that were made previously, we would have completed quality impact assessments to reflect those changes. So we did have areas where we had changes, and that's mainly to accommodate our skill mixes. So for example, where we needed to bring in registered nurse associates, our band 4s, we were then able to skill mix some of the staffing that we already had to create those new roles, and we've previously spoken about those. Hence, there isn't any recommendation to be changing these staffing levels at this time. Provided information on assurance and what's working well with regards to our staffing, and I'd just like to ask Board to note the report, accept that staffing is a challenge, but that we are monitoring the safety of the areas where we deliver patient care and certainly not reporting any deterioration in those. Thank you, Chair.
Thank you, Linda. Okay, a comprehensive report. Angela?
Yeah, no, thanks, Linda. Really helpful to understand that that oversight on that safety. But could you just share a little bit more in terms of the triangulation that's done in terms of safer staffing with other incidents, just so we get a sense of that? Because I know that is also something that you're spending a lot of time doing, but just to give a little bit more sense of that, please.
Thanks, Angela. So the triangulation that we complete includes various components. So we start to look at the staffing that was available. So what is it on the rota? We start to look at the skill of those staff, because that could actually affect how care is delivered. We'll look at any incidents that have been reported during that period. So for example, if an area has had reduced staffing numbers and we suddenly see a spike in activity, it could be violence and aggression, it could be falls. We then look at linking those. Is there direct link with regards to that, and what action needs to be put in place? We also look at things like what other activity has been taking place. So whilst it might look like a ward has been short-staffed, they've had incidents, could it be that there was an escort that has happened, but actually someone else has come in to cover? So we have to triangulate all that information to actually understand, are we concerned about this specific area? In some of our areas, you know, Angela, that we do have a full complement of nursing, AHP staff, but also we have other colleagues who then support that through psychology, through medical. So you actually have a robust MDT working with the team. So when we start to triangulate the incidents around that, we're not just looking at nursing, we're also looking at that wider MDT that could impact on staffing levels, which then affect the delivery of care. So we do triangulate all that information just to understand if an area is requiring additional support and if we're concerned and need to flag that. Thank you.
Thank you.
Thank you, Linda. The only other question I had, Linda, was just there's a reference to professional registrations to reported registration issues, and I just wondered if there was, I mean, obviously we don't want to talk about individuals, but just in terms of the process for resolving that, be helpful. That was on page. Actually, I don't have a page number to give you, but there are 2 reported nursing and midwifery council registration issues, the paper says.
Yeah, so with regards to registration issues, Krishni, the ones that we've had reported here will be where the practitioner has not completed their paperwork, their re-registration in time. So the first one was with regards to their revalidation. So an extension was requested and agreed. So they'll still submit their paperwork and continue with their work. And that has been agreed till the 31st of March. The other person was someone who is under investigation for practice issues and actually chosen not to then re-register, which is not unusual when people are facing that. And sometimes it's a decision that some people make as a result of they're now leaving the profession or retiring, but certainly there's an ongoing investigation with regards to that. But all the staff that will have reported here will be supported. They will have received restorative supervision and certainly will continue to be supported through that process. So they're just not left when their registration has lapsed. Thank you.
Thank you, Linda. That's really helpful. Thank you very much. Okay, so again, with this paper, we are really being asked to note the assurance being provided and obviously the processes that are there. And as Linda said, clearly this paper also goes to the People Committee for scrutiny. So, so thank you. In the absence of any other questions or comments, then we will just note that. So that concludes our quality section of our board agenda today, and we move on to people section. So first of all, the AAA from the People Committee, which I think Judith is presenting. Is that right?
Indeed it is, yes. Thanks, Krishni. I had the pleasure of chairing the People Committee in February. I will take the report as read. I, again, will just draw out a couple of points. First of all, under alert, we have the agency spend report. Now, the report continues to be under alert, because the amount of work that is required in relation to further reducing agency spend is a lot. In a short summary, and we have been very successful, however, at pushing down the spend on agency over the months. And in fact, we've been so successful that I did manage to persuade committee in this instance to also put it under Celebrate Outstanding, because the committee wanted to recognise the sheer amount of work that has gone into this project. Although we're not at the end of the year, I recognise that we have managed to split this into both Alert and Celebrate Outstanding. Under Advise, we have the workforce dashboard. The committee noted the positive outcome for training and appraisals, but sickness and continues to be long and short-term sickness continues to be a challenge, and there's a deep dive exercise that the team is currently undertaking to address this, including reviewing training around sickness and how to deal with it for managers. We had a discussion under Assure for retention and received an excellent update on the work that is being done around retention and retention rates for our staff using the Start Well, Stay Well, Leave Well framework, which I just wanted to mention under Assure. Under risks, we had a discussion around the wording for the two risks that the People Committee get assurance on, but clearly with the change of our strategy, there's going to be change in any event. Now, the last thing I just wanted to mention was another Celebrate Outstanding point, and that was in regards to workforce planning. The People Committee received an update on the work that is currently being done on workforce planning, and we received tons of assurance and we really sort of positively wanted to comment on the report, but also on the work being carried out, which really prioritises patient need and patient experience. And we have, in fact, the Trust has made significant reductions in agency as a direct result of this workforce planning. So again, just wanted to highlight this to the board, and the number of other items have already, within this AAA report, have already been mentioned here. So I will leave it at that, but happy to answer any questions, and I'll hand back to Tim at the next round. I hope he doesn't mind too much that I took over for one round.
Thank you, Judith. Joe, please.
Thanks very much, Judith. It may actually be a question for Chris rather than you, but on the deep dive on sickness, I mean, this is a theme that's reoccurring. You know, it was in the previous paper, it's been in certain papers in the pack today. Just in terms of the scope of that deep dive, because certainly on service visits, there is a thread coming through about how our policies, not just in terms of management training, how our policies are restricting the manager's ability to deal with sickness. And I just wondered, Chris, whether that was something that was being dealt with in the deep dive, just to review and a refresh of the policies that we operate.
Yeah, yes, Joe. So if we start with policy, we've done a deep dive into the cases, and I think it's clear that the policy isn't actually structured in the best way at the moment. That's being revisited to rewrite that, support it. We have, as a result of the number of areas we've reported here from the riots on race, we've developed a 2-day programme to give managers the core skills to deal with staff, and sickness is a key part of that. And we are working with the managers. We've got very good feedback about that and how people really need to focus on the informal sections. We've also discussed how managers are using Occy Health, and that maybe they're not understanding the role of Occy Health as well as they could, which ties in with our review of that. And work is already going on the cases to review it, and I think that there's a seasonal element, but I think that undoubtedly will have fed into the reduction in sickness. So, and an overall report's going to come through that we're going to present to the Executive Management Board. So I think hopefully you get a sense of it is a complete root and branch piece of work to tackle sickness and deliver improvements across the board.
Okay, thanks, Chris. That's exactly what I wanted to hear. Marvellous.
Thank you, Chris, and thanks for the question, Joe. Yeah, it's I mean, clearly how, there's a lot of work ongoing around recruitment and retention. But in terms of agency use, there is always a risk, isn't there, that sickness absence will drive agency use. So obviously improving that can make a material difference in terms of that expenditure. But equally, I guess part of the approach has been also to move towards higher use of bank as well, hasn't it? So, I mean, really positive work on the reduction in agency, but still more to do, I think, is the ongoing theme. I was interested also to see sort of the comments around workforce planning and the work that had been done on that, because I think one of the challenges we've seen more generally around NHS organisations is our ability to triangulate sort of activity, finance and workforce. And that has been, I don't know whether, certainly in some parts of the NHS, that's proved to be quite challenging. And I know that's been a discussion that's been held at the Regional People Board around that. So it's good to see the focus on workforce planning, because it really sort of recognising how much of our expenditures on workforce, it is really important to get that right, isn't it? So good to see some assurance around that, I think. Any further comments regarding the assurance report before we move on to the substantial items? Okay, thank you very much for that. So over to you, Chris, then on the paper O, which is the staff survey results.
Thank you, Krishni. So just to pick up some of the headlines, overall, I think we can see a very positive survey, 60.27%, which is increased. I think that's the highest we've ever had. On the people promise, we've very much retained our position and in the upper quartiles, and significant increases in two areas, and where they're reductions, they're very small reductions. Our recommendations as a place to work and a place to receive care have also both gone up. We had a slight decrease in staff engagement, but some areas have still increased. Very importantly, we've had an improvement on health and wellbeing, which is one area in the last survey we were challenged at, and that probably reflects all the work that we've been doing in this area. On the racism section, again, a really positive and increased response, which I think shows that people feel they're engaged in it. And I think based on all the work we've done, because we haven't always seen that, we've seen an improvement in the staff experience in terms of bullying and harassment for managers and colleagues, and that's really encouraging shift, which hopefully we will maintain. The big concern remains bullying and harassment from patients. We're fully aware of this. It's emerged in the work we've done in response to the riots and the TAR. We've got a major programme to revamp our Say No to Racist Patients, how we deal with staff who experience this on the wards, and also how we deal with patients if we need to look at whether treatment needs to be withdrawn. And we've got our clinical staff, our medics involved in that. So it really is being fully gripped and taken forward. The point Dave did mention earlier, the visibility. So as part of response to that, if you do go around the wards, you will see lots of posters about Together Against Racism, and it's not okay to abuse our staff. And in fact, in all of our major sites, we've now got very large banners as you come in making that statement. And I think Anne has shared that we've had feedback that that is impacting, because both patients and staff are seeing that. So backing that up with the policy is a key area, because that has worsened, which is a concern. But I think we feel that obviously a lot of this work has come in at the time the survey was being done and followed on. So I feel that we've got a really solid action plan to help improve that. On the WDES, again, staff feeling about lower levels of harassment and bullying. The pressure to come back to work is a concern, but the wellbeing group has a lot of involvement, and we will be picking that up. We've actually got a workshop this month to look at the feedback from the staff survey. So again, we can assure the board that we will be taking on that immediate action on that immediately to look at what we can do. The bank staff again have increased in their terms of positive response on the trust as a place to work and to receive care. And we will be working on some key issues for the bank staff. There's a comprehensive staff engagement plan, which we've been working on when we'd had the earlier results before the kind of national benchmark results have come back. And we've already engaged with directorates to understand what their priorities need to be and how we take that forward. So I think in summary, we'd say that, we have got a very good staff survey. There are some areas, as is always the case, we need to focus on. But I think a lot of those, there's already plans in place to address them and we're moving it forward. And as we said, there's a comprehensive staff engagement plan. So we'd hope, we would recommend to the board they can take assurance from the staff survey and support the staff engagement plan to take this work even further forward. And I guess build on what we talked about earlier, to continue to develop our culture, which is what drives a lot of these positive responses. Happy to take any questions.
Thank you, Chris. Any questions regarding the staff survey results or comments for that matter? Julia and then Melanie, please.
Thanks, Krishni. Chris, it's just a comment. I absolutely don't underestimate the amount of work that goes on for all staff throughout the organisation to help others feel supported. And that's what the National Staff Survey really tests. And actually, I absolutely commend what a fantastic set of results. We're not complacent. I absolutely get that through all the reports and, through all the sections that you've identified that we're focusing on areas to improve. But actually, just wanted to say what a set of results through very, very challenging times. Two things specifically for me. One is that an increase in the number of staff feeling that they feel safe to report unsafe clinical practice. Again, that's really important. We've talked about value programmes. We've talked about finances. So for people to be able to feel that if they see something that's not appropriate in a clinical setting, they can actually speak up is really, really important. And we'll get some of that through Quality and Safety Committee. So that's really good to see. And also to commend the, being able to say no to racist patients. As a clinician, it's very hard when you just want to care for people. And when you, are on the receiving end of some abuse, that is terrible. And actually for staff to feel that we back them as an organisation completely, and we have a very strong, very secure process for that, and we'll say no, it is really important. So thanks, Chris, for all your leadership on this and others in the team and through all the execs and all our managers throughout the organisation, because it is a really fantastic staff survey set of results. Thank you.
Thank you, Julia.
Thanks, Julia and Melanie.
Thank you. Yes, and I echo Julia's comments, which I won't repeat, but very much recognising the strength of these results against a backdrop of such uncertainty. And last year, when the survey was undertaken, the grip of so many other sort of factors that could influence results. Unsurprisingly, is the lead NED for Freedom to Speak Up, whilst I absolutely echo Julia's comments about how brilliant it is that we've seen an increase in raising concerns about unsafe clinical practice. I note the national trend of a sort of a slight reduction in staff feeling safe about speaking up more generally, which is echoed here as well. And I look forward to working with you, Chris, and sort of with Beth and the Freedom to Speak Up team around sort of understanding that and how we help to support staff to feel more confident, because within our culture and our trust environment, speaking up is so important. And it's important that we understand why staff should be beginning to feel more reticent. Maybe a very small reduction, I accept that, but even so, something that's really important to focus on.
Yeah.
Thank you.
Thank you. Just one comment really from me. Obviously echoing other colleagues' comments about the positive set of results. Interestingly, the region did an analysis which is purely based on staff engagement, which was covered at a chair's session. I wasn't actually there, but I received the slides afterwards. So it looked at all of the staff engagement scores based. I think it's a group of questions, isn't it, that make up the staff engagement score. So they were comparing that across various organisations, and reporting the importance of that measure because of the sort of research, the Michael West and other research that shows the connection between the staff engagement scores and the quality of patient care. So, and we were reported in that set of slides as the third highest for staff engagement in our peer group in the region, comfortably above the sector median across all of the whole of the mental health sector, but there had been a very slight drop in staff engagement in the mental health sector across the board. It's just that it wasn't regarded as statistically significant. But I thought it was important to mention that, you know, the focus that the region had on the staff engagement score in particular, and how well we compared actually in relation to other trusts in the same grouping. So that was that felt important. The one question I had, and also actually just some of those res results are important as well. I think it's important to note that. The one question I had, which is more a curiosity really, is that if I've understood it correctly, Chris, the bank survey results, people are more positive as a place for care or treatment and a place to work as bank than as substantive staff. Which is that normal? Is that the situation everywhere? So it's just slightly more positive, I think, on NHFT as a place for care and NHFT as a place to work from bank staff than it is substantive. Is that across the board for other organisations as well? Because I wouldn't have thought that. So I don't.
I haven't seen those. I haven't seen those figures, Christian, so I can't question that. I mean, it's hard to. The only thing is sometimes there is a thing statistically. I know this sounds really strange, but when you get, it can go either way. When you get a lower response, it can be the positive people responding, or it can be the negative people. So you might have a statistical thing there. But I think I think the thing is that we are working very hard. I mean, we ran the bank conference 2 weeks ago, I think, which I can't think that many other trusts will be doing that. We gave bank staff a whole paid day off, and there were about 150 of them, and they raised issues we've got to pick up on, but they all were incredibly positive in what they were doing. And I think what came out to me, and Angela's talked about this, we've got to really think about our bank staff not as bank staff, but as people sort of choosing flexible working. And I think we've got to do more work on that, because I think that's clearly something that they all think. And some of them are very loyal and work with us a lot of the time, almost permanently on bank, but they're still on bank. So I think there are some things to unwrap there, Christine.
Yeah, thank you, Chris. I mean, you're right. Of course, the response rate is not as representative as the substantive staff response rate, which was absolutely fantastic this year. So that may be a factor, and I think it's really important, the point about, you know, we need a flexible workforce. Actually, it's helpful to have a flexible workforce, isn't it? That isn't agency, and it is a point we've made at the Regional People Board that it's really important, because I think there was a bit of a focus on, you know, the increasing use of bank, and a bit of a concern from the centrally that it was actually driving up the use of bank in a way that was unhelpful. And I think a lot of people made the point that actually having a bank workforce can be really, really positive, and it is often very diverse, a bank workforce. And there is a danger in driving that down in a way that is unhelpful to us. So, useful comments there and reflections. Thanks, Chris. Tim?
Yeah, just a couple of things. Firstly, great set of results, and well done to the team. That's amazing. Just on that bank point, we did some work last year, because in our organisation we saw exactly this point, that bank staff scored us slightly more favourably. They pointed to two specific things. One of which was they appreciated us as an employer offering them flexibility in their way they can work. And secondly, they were really keen to make the point that their care is no less good than the quality of those who are full-time staff, and were really scoring as a result of that. But those specifically came out last year for us. So I think it's a theme coming through if you engage them well.
Thanks, Tim. That's really helpful. Judith?
Thanks, Krishni. Very good result. Definitely celebrate that. I'm specifically focusing on increased responses from our ECM colleagues, and also welcome the continued work with our staff with regards to saying no to racist patients, to combat the abuse that staff continue to receive from patients. So welcome that. Thank you very much.
Thanks, Judith. Just really also to note that we are going to be talking about these results with our governors, and I think Tim and Melanie have kindly volunteered to present that together at our next Council of Governors meeting. So we thought it was important to share these results quickly with governors. Excuse me. But I think at this stage, it's really just to note the results, congratulate everyone involved, and note obviously a huge amount of work now to focus on areas that need further focus as outlined. So thank you, Chris. Back to you then on paper P, please.
Thank you, Krishni. Paper sets out the key elements of the gender pay gap, and I just wanted to highlight some key areas. So the gender pay gap has again reduced on the mean average from 15 to 13%, and that's steadily improved from the 20% in 2017. The median, and again that compares as a kind of average across the UK at 13%. So we're very much in line with that, although we would look to improve on that. On the median pay gap, which is seen as the more accurate indicator, again, we've seen a drop from 5.7% to 2.81%. We've provided further detail on the other elements of the gender pay gap. I think in this report, slightly different to the previous one, we've provided more detail. I think, I don't know if Joe remembers, but at the last time we looked at this, Joe suggested we go and talk or look at what other organisations were doing, which we did. We've looked at what we were doing and sort of benchmark and built on the things we were actually taking forward. And we've actually detailed those in a lot more detail in this report to share what we're actually doing. And hopefully I think colleagues can see that there is a lot of work, which I think we can probably accept is impacting. I think I've just pulled two areas out, although there's a lot of good work. We've got a brand new flexible working policy, which clearly I think often for our female colleagues, having that flexible working is a key element of what's needed. And the inclusive recruitment is a major piece of work. We've now got 150 people that have taken that forward, and we've had really good feedback about it. But it's interesting, the course has been a prompt for a co-production for our recruitment policy, which has been completely overhauled with input from the networks, the staff networks, Reach, Enable, the trade unions, and I would commend it. It's a really positive recruitment policy. It really gives a lot of detail in areas that weren't there previously, and people are feeling very positive that we've done that. I mean, particularly the trade unions have said that that's a kind of model of how we could do it, and we also did it very quickly. We revamped that policy based on the feedback we'd had, and also in response to the work from the riots. That has actually been developed over 3 or 4 months from starting to get all the feedback, all the consultation, and now it is already in place and is running and aligning for everybody. So I hope that does give the board the assurance that there are lots of initiatives within the trust that are in place which will further help us reduce the gender pay gap.
Thank you, Chris. Any comments or questions about this report? No, I think it's a very comprehensive report. Joe?
I was just going to type it in the chat, but I'll say it instead. Chris, thank you. The report is certainly it feels a lot more rounded than last year's report. And although there are obviously still issues that we're trying to address, I gain a lot more assurance with that degree of detail factored in. So thank you for that.
Thank you, Joe.
Thanks, Joe, and good to see, the pictorial representation of the progress. Obviously, more work to do, but it's important to report that the progress is being made. Chris, so absolutely, pleased that with that. I just wondered whether you can make a comment about the other protected characteristics and where we are in relation to producing similar analysis around ethnic minority and other protected characteristics, because I think that's part of the EDI improvement plan, that we begin to focus on those areas as well. So just wondered if you could say a word about that.
Yeah, we've already done the work to look at the equality pay gap, and we did take a paper to the People Committee setting out where the distribution of staff were in the pay grades, which does start to indicate there's a fairly equal balance there on that issue, which is positive. We are building up to doing the full report, so we are planning to take a report to SEB, the next SEB in April, to start to talk through it, and then we can consider where that should go to People Committee, the board, how we then report that within the organisation. So yes, that is all fully in train, Krishna.
Okay, thank you. Yes, I think it'd be useful to go to People Committee, because I think this is the one that we actually have to legally undertake, isn't it? And the others are ones that are sort of requested by the NHS as part of the EDI improvement plan. And in this, we are actually approving this document to be published on our website and onto a government website as well as part of the requirement. So so very happy to approve this, and I think we can.
You're on mute, Krishni.
Yeah, you've suddenly muted accidentally.
Sorry, accidental muting there. I think we can. We'll certainly receive this report and approve it for submission, but also I think it would be helpful to receive it further information about the other areas, the other protected characteristics, to the People Committee. So thank you very much. Okay, we'll close that item there. So moving on to the governance assurance section, we've got our AAA report from the Audit Committee. So over to you, Duncan.
Yes, thank you. Like others, I'll just pull out a couple of points from the report. The first is the usage of waivers remains under advise, as it has been in previous reports. We have seen a slight deterioration, but the committee received feedback as to how new procedures are coming into place. In particular, the change in rules around the provider selection regulations had given a bit of an anomaly there. It does, however, stay on advice because we're keen, frankly, just not to leave any value on the table in our procurement practices, as resources are so scarce. Moving on, we had good comprehensive reports from the anti-crime colleagues, in particular outlining the work that's going on with the National Fraud Initiative and the work with the Cabinet Office, and received the plans going forward from both counter-fraud and anti-crime. Our internal audit colleagues presented, in particular, 2 reports, of which there were a couple of items of importance. They reflect their reports to us with recommendations under 3 headings: urgent, important, and routine. There were no urgents, but just the 2 importance. The first of which was under the financial controls, where we had some issues that they identified on the overpayments of staff. We received assurance back from colleagues about the new processes with the HR2 forms to make sure that late notifications are being addressed. And the second was addressed earlier in the meeting about the risk management report, where essentially the issue there that the internal auditors were raising was the results of the change in the terms of reference of the committee, where it's taking on a greater role and responsibility for risk, and the assurance that the risk processes are working well within the trust as a whole, as opposed to overall looking at risk, which is the board's responsibilities. Last couple of issues, we had good updates from the internal auditors on where they are with their summary internal controls assurance report. I'll get my tongue round it in the end. And also the head of internal audit opinion. Both of those pieces of work are on track, and it was really pleasing actually to note that there had been no limited assurance reports so far this year from the internal auditors. So that was really, really good. Grant Thornton told us that everything was on track with their work. It's a busy time of year for the technical accountants and the auditors getting everything ready for the end of year audit. And we're pleased to have worked together with Richard and Paul to make sure that we've got plenty of time in our timetable this year, where the committee will take a review, a detailed review of the audits report and the annual accounts. That's scheduled in for the 12th of June with the ISA 260 report that the board undertakes on the 19th. And then finally, Dave provided us with a really comprehensive and good review on the risks emerging on AI and how the trust is working on that. I'm happy to take any questions.
Thank you, Duncan. Really helpful, and particularly good to hear that there have been no limited assurance reports. I think that's really important for the board to recognise. Any questions on anything in the report, or any further comments from any other members of the committee or board members? No? Okay, thank you very much. So we'll note that report. Thank you, Duncan. And we move on then to the joint working group highlight report, which is over to Julia as co-chair with Faisal. Thank you.
Thanks, Krishni. So just to say, take the report as read. This was hopefully the last meeting in its current format, depending on how we view the next paper, Paper S, which is coming up, because we're recommending to the board that the group becomes part of the public board between both trusts going forward. So we'll cover that in the next section. But this meeting particularly covered the journey of the group from 2019 to current day, from being a buddy trusts to being in a group model with Leicester Partnership Trust, and we looked at the key achievements across shared priorities. And David Williams gave a great story around some of those achievements, and we felt that was really important to celebrate what we've done so far. So thank you for that, David. And we said actually that needs sharing much wider, and I think that's the plan, that we help people understand the journey that we've been on together with both organisations. Just to say that some elements from the programmes obviously will continue. It's not they're stopping, it's just how we look at them and how we monitor them through hopefully the joint board format. One really welcome addition this time was some performance information from both trusts on similar areas of service delivery, and we felt that was really helpful, almost like a little mini benchmark exercise, and we're going to take that forward, I think, through to the joint board and some areas to look at in the future. And then just lastly to say, just wanted to acknowledge not just the formal arrangements and partnerships and relationships that have happened through this arrangement with LPT, but also the informal relationships that have built. And we've heard so many stories through the programmes over the last couple of years of how clinicians and others have jointly worked together on all sorts of areas. And it's had a hugely positive impact for not only for the staff, but also for patients, service users, and actually our communities. So just wanted to acknowledge that as part of this possibly last report from the Joint Working Group. Happy to take any questions or comments.
Thank you, Julia. Any questions or comments on that? Judith.
Thank you. Just really an observation that I've only recently started attending the JWG, and I've really seen a change, and to understand the work that is going on across the two trusts has been really valuable. So I'm looking forward to this new development that will actually make it much more public as to what is being done, which is going to be very positive. So thanks.
Thanks, Judith. And I was just really going to comment. I mean, I think we got very excited when we started to get the joint, when we looked at the performance pack that Dave, I think, and Dave and Jean had been working on, and thought, okay, this is going to be very exciting when we start to use this. I think we touched on including some of the staff survey results within that as well, so that we could benchmark that and look at driving that. Yes, we're looking forward to that proposal, which is next on our agenda as well. So yeah, important conclusion to our discussions there. So thank you. If there are no further comments or questions regarding the JWG report, we then move on to the group board meetings and public paper, which is paper S. Richard, do you want to comment on that?
Thanks, Christy. Yes, just to say that the board members will be well aware of the development of this proposal, as we had some time in development workshops discussing both ourselves but with colleagues at LPT how we wanted to shape this new development for us as a group. It really, I think, resonates with the approval of a group strategy to have a governance mechanism in place to support oversight and monitoring of it. I think importantly, the proposal to establish a group board meeting is not going to affect the sovereignty of individual organisations. It's really adding an additional mechanism for us to come together and, as Judith was just describing, really to be transparent in public about the work that we're doing as part of our group. So this is very much an outline proposal at this stage, which will inform then the refresh of the supporting governance document, our memorandum of understanding behind the scenes. I'm already working with my counterpart Kate Dyer at LPT on this, which will hopefully, subject to the board's approval today, of course, be brought back then to formalise those arrangements as we launch our group board meetings. As Julia has already helpfully trailed, within the paper is also the proposal that we essentially disestablish the joint working group, which has served us well hitherto, but would then be supplanted by the role of the group board meetings in the future. And to avoid any loose ends, we'll therefore be behind the scenes transferring across any ongoing pieces of work on the JWG's forward plan to the relevant plan, either of the group board meetings themselves or to individual programme or trust meetings. So in essence, I'm seeking really approval from the board on those two areas. One is the outline proposition for the establishment of a group board meeting with LPT, and the other is the disestablishment of the JWG. Happy to take any questions on the proposal as well. Thank you.
Thank you, Richard. So any questions? I think this was trailed at a recent joint board development workshop where we talk through some of the sort of principles. As Richard says, the detail just needs to be worked through into a further proposal, but at this stage very much just really looking for formal board support to take that forward. Angela, please.
Yeah, no, thank you. And like others have said, welcome the next stage, if you like, in terms of this journey that we're on across the group. But I think also just to say that David's put in the chat about the reminder about the story, because not everybody's been on the journey for forever. That's really important. But I think importantly, during that period of time, we've seen more groups emerge. And I think that is something that, we recognise, and certainly has been more of a feature in the architecture across the NHS, more shared roles, etc. And I think equally, just reflecting back to the early discussions around changes in the NHS, I think groups, collaboratives represent an ideal and unique opportunity to take some of the work forward, and to really think about its role and our roles in that as integrated care boards become, if you like, different and clearly up for progression and transformation. Thanks, Krishni.
Thanks, Angela. Julia?
Thanks, Krishni. Yes, just to say that I think the opportunity for some of the committees perhaps to do some work, I know that's part of the proposal. I meet with my opposite number over at LPT regularly, and I know the other chairs have contact with their opposite numbers. And I think it's going to be really, really important going forward, because then we can have discussions once, and more heads around common problems will be much easier to solve things, I think, and share risks and how we're managing things. So really look forward to that. But absolutely welcome the proposal. Thanks.
Thanks, Julia. And certainly, I think it's really important that the vehicle that we, the way in which we want to use this sort of will, as Richard clearly said, still recognise the sovereignty of the individual organisation, but bring us together to address those sort of common issues. And I think we touched on the idea that it's very much sort of boards in common, whatever the language, the technical language will be, but it will be both boards in the room together discussing issues that we agree are helpful to work on together. And then there will be other things that we do need to take forward as individual boards. So it's the flexibility of that opportunity, and particularly, as Judith said, I think transparency to members of the public around the discussions we're having together as two organisations, and then the opportunity for further learning and improvement, which is really ultimately what drives this, but doing it in a public setting, I think is really helpful. So I would just want to ask for the board's endorsement of the proposed approach, notwithstanding the further work that needs to be done, but also to approve the disestablishment of the joint working group, thanking colleagues who've supported that, and all the work that's been done to take that forward. But it does feel genuinely like this is the next phase, and a very exciting one. So I'll take it that everyone's happy to approve that. Great, thank you very much. So we have our final item of the governance and assurance section of the agenda, and that's the board development programme. So back to you, Richard.
Thanks, Krishni. Yes, this is very much a living document, in the sense that we, with our board development programme, we aim to be responsive to emergent opportunities to learn and develop. So board members will recognise much of the content of this report as it sort of builds on content that's been received previously. Notwithstanding that, I guess the point in the report in particular to draw out is the proposal for the 25-26 year. Building on the conversation that we were just having about the establishment of a group board, you'll see that we've got opportunities both for us as an individual organisation and as a group to come together in leadership and governance topics over the coming year. We've set out what we know at the moment, which largely relates to the NHFT board programme. As you can see in the report, now that we've approved the progression into a group board context, we'll then start to articulate more clearly the proposal for the group development workshops. We are incidentally harvesting ideas from committees and also taking the opportunity to do things in common where it makes sense to do so. So, for example, in the April session, we're likely to do some training that's common to both boards as we know that that's often beneficial to learn from others' experience across the group. So really at this stage, it's to give you a sense of what we've got in plan for 25-26, and indeed to take any feedback or suggestions on what we might want to add into the plan as we go forward. So happy to take any questions on the report. Back to you, Krishni. Thank you.
Thank you, Jo.
I think one of the opportunities, Richard, particularly in that joint context, maybe something around the 3 shifts, and how we're responding. And I know it's something that Dave and his colleagues have been talking about a lot with us, but maybe something across the 2 trusts would be particularly opportune, and where we can build in something about approach to waiting list management, because I think, again, it's going to be something that that the government are going to be pushing hard on. And again, if there's best practice that could be shared or other opportunities, I think those would be both useful for board level conversations.
And that's a suggestion, Jo, for joint board conversations on those areas. Yeah, thank you. Yeah, really helpful. Thank you. Any other suggestions? It's important. I mean, obviously, this is a very flexible document. It's not set in stone, but it gives a sense of what needs to be covered. And I've certainly fed back to both Kate and Richard that I'd like a degree of without sort of forcing it to be exactly the same, because that there's no need for us to do that. Certainly some commonality. So because there'll be topics that we as boards need to cover, that the content will be different because it's specific to us, but the need to cover it is still the need to cover it. So I've certainly asked Kate and Richard just to work on that. A couple of points that I wanted to mention, one on just freedom to speak up. Richard, I think that we will need a session, I think, with the Guardian, and I'm not sure that that's included in that, but normally that would be something we'd want to do. And also, I think we need to have medium-term financial planning on our radar, because I think it is, you know, that sense of this is an ongoing process rather than an annual waiting for NHSE guidance process on what the future looks like. I don't know, Paul, you think that's reasonable, but I do think a regular conversation on that sort of at that kind of level might be helpful.
I certainly think that, given the planning round, Krishni, that's to be honest, essential. I think conversations over the last few days echoing your points around the fact that this isn't just a one-off, and actually some of the challenges that we've got, it may be that as we're putting processes in place, that we embrace them earlier, you know, and get on with it, because that helps for that helps for 26, 27 and beyond as well. So I think it does need to be a regular feature. I think the updates that we'll bring on the back once we've got the 25, 26 plan nailed down, we'll be able to do that very quickly. And I think that the earliest opportunity the board can have to discuss that, I think, will be an important factor about how we plan our way through.
Thanks, Paul. Melanie?
Yes, I think this may fall into the category slightly that Joe's already covered, or maybe even just into the flexibility that you referred to in terms of items that might crop up across the course of the year. But it strikes me that with the changes to NHS England, the changes potentially with ICBs, we certainly probably need to have a placeholder in the board development workshop that's about environmental change, maybe, and sort of new structures, frameworks, requirements. And the other thing that I wonder whether we should try and structure in some time is to really bring the board together, and this might be a joint or individual, about neighbourhoods. And this might come into Joe's comment about the shift to community, but I don't think we necessarily as a board sometimes think enough about the sort of the opportunities that neighbourhoods provide us and how they are evolving and emerging in Leicestershire. although we do touch on it in various different contexts. And with that, I also wondered whether, alongside having development workshops that are in partnership with LPT, there may be other organisations that we might want to engage with in a development setting. And again, as the environment evolves over the forthcoming year, maybe trying to get some time with the ICB, maybe trying to get some time including a wider range of stakeholders might also be helpful, rather than always being just sort of with ourselves as the audience.
Thank you, Melanie. I mean, yeah, I absolutely support any opportunities, I think, to get together with system partners. Always more challenging to organise, and obviously reliant on partners wanting to engage similarly. And I think it depends also what sort of collaborative arrangements might exist as well. For example, I mean, this doesn't particularly apply in Northamptonshire at the moment, but we have a UEC collaborative in LLR, which does include NED representation and exec representation. So there are different vehicles for some of that, aren't there, that we might want to think about and encourage. And that may well be one of the things that emerge out of the new landscape, is because I think collaboratives will still be very much a part of that. But yes, we should keep our opportunities. I've certainly emphasised the importance, I think, of NEDs coming together, supported by relevant execs engaging as well within across the system, because I think, and I've encouraged the same in LLR, where it doesn't currently happen quite in the same way as it does in Northamptonshire. So those things I think we need to take advantage of. But I specifically on the topic, Richard, around the emerging landscape, I think is one that we'll probably need to cover across the group, really, because it's probably a common message, isn't it? But that is going to be something we're going to need to be cited on and have opportunities to discuss. What does that mean? And unpick it, really, because there's a lot to understand about that, I think. Julia?
Thanks, Christine. I suppose it builds on from that. My point was around, we had a very, very good session last year with LPT from our CQC colleagues. So it builds in just to the environmental changes and things that are emerging. But that would be a really useful session as their processes change and personnel change, etc. And I know the Trust has a really strong relationship with our CQC colleagues and meets regularly with them. But actually for us as a wider board, that would be very helpful, I think, to build that in future plans.
Yep. Thank you, Julia. Yeah, good point. Duncan?
Yeah, my point goes back to the medium-term financial plan and the free shifts point. And the thing that I see the opportunity of is perhaps looking at the proximity of those two debates, and in particular with reference to the BAF and the way that in the past we've not seen our BAF scores move sufficiently, which we've debated elsewhere. The opportunity, perhaps, Paul, to take a look at business cases that are coming out at the moment in light of those free shifts, and set an impact assessment of how they're going to be impacting on that medium-term financial plan. So forgive me, three strands all coming together. It strikes me that there's an opportunity there to start pulling those thoughts together in one setting.
Okay, Duncan, thank you. Anne?
Yeah, I just wanted to come in on the neighbourhoods part that Melanie was mentioning earlier. I think as we're progressing as a system into more of a collaborative space with neighbourhoods around primary and community partnerships and same-day access approaches in primary care, this is going to be really important. And as we just structure those meetings, just considering what the makeup of that should be. We will have exec leads in there. It's whether the format gives for bringing a wider audience, and I think we should keep close to that and see, then we could bring that into any of our development work that we're doing in NHFT as well.
Okay, thank you everybody. Richard, have you been able to capture some of those thoughts, and are you comfortable that you can reflect that? So I think that just
Indeed.
broadly, it's sort of there's some things there around environmental changes in our environment which might impact on us, and making sure we understand those collectively. I think that includes the 3 shifts and the long-term plan when it's published, and what those things mean. Irrespective of all of that, I think the sort of sense of the medium-term plan and how we drive value continuously rather than as a sort of annual process. We've talked about CQC and Freedom Speak Up as well. So some specific areas and some broader areas that are more about the general context. But it is something we can, obviously the board at any point can really agree that it's something that is a topic that we need to cover in one of our development sessions, and that flexibility will always be there for us to do that. But it's always good to identify things that we'll want to talk about as we go through. So thank you very much for contributions on that, and just note that is the plan at the moment. Agree that we'll add the additional things that have been highlighted, and continue to evolve the plan over the coming year. So thanks very much. Right, well, I think we're now at the end of our sort of main items of business. We do have the register of interest available for public scrutiny as paper U, and it's just there for us to note. Just a reminder also that I think our the request to update that has been sent to every member of the board. I think the deadline for it is today, if I remember correctly. So if you haven't already completed that, there is a link for us to update our declarations of interest alongside a fit and proper persons return, which I think has been issued for us to complete. I don't think I've got any other business other than to note again that this is Chris's last meeting, and thank him again, as we've already recognised through the course of the discussions. And then finally, any other points regarding the effectiveness of the meeting today? I think the timings feel very appropriate because we've landed there or thereabouts, which is helpful. But is there anything that colleagues feel we should have covered that we haven't, or any amendments or reflections in relation to the risk register, or communications points that people would like to highlight? So any feedback on the meeting? No, quite content about the meeting as a whole. Okay, well, thanks everybody for contributions today, and thank you to anyone who's watching this meeting back and engaging with the content. And I will close the meeting there. The date of our next meeting is the 29th of May at 9:30, the date of our next public meeting, and we will therefore close this meeting, and board members, if I could ask board members to be back for our private meeting at 1:30 as planned. Thanks very much, everybody.
Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.